Pooja, now you can start.
Sure, sir. Thank you.
Okay.
Thank you, everyone. Good evening, everyone. Namaskaram. Today we have with, I hope my voice is audible.
Yeah, audible.
Yes, thank you so much. So, good evening, everyone. Namaskaram. Today we have with us for this webinar on COVID-19 and black fungus, a myth or reality, two very eminent doctors, Professor Ashok Chako and Dr. Rabindranath E. I would first like to introduce Professor Ashok Chakku, who hails from Kayangulam, but was born and brought up in Chennai, and he did his schooling in Don Bosco, Egmore, Chennai. He did his MBBS from Stanley Medical College, Chennai, MD and DM from Christian Medical College, Vellore. Doctor has spent 37 years at CMC Vellore, and he's currently HOD, Department of Gastroenterology and Liver Diseases, Chair, Division of Medicine, Naruvi's Hospitals, Vellore. His past administrative positions include being the president of Indian Society of Gastroenterology, past counselor of Asia Pacific Association for Gastroenterology, associate director of CMC Vellore, additional vice principal CMC Vellore. Dr. Chako has also received numerous awards, such as the Professor K.V. Tiruvengadam Oration, Professor Mandagopalan Oration, Award for Academic Excellence IMA, Lifetime Achievement Award IMA, Fellow, he is also the Fellow of Academy of Medical Sciences India, Fellow of Royal College of Physicians London, Fellow of Royal College of Physicians Glasgow, and also holds a Fellowship of International Medical Science Academy. He also has membership of several professional societies, such as the Indian Society of Gastroenterology, National Academy of Medical Sciences, Society of Gastrointestinal Endoscopy of India, International Medical Science Academy, Indian Medical Association. He is also on the editorial board of Journal of Gastroenterology and Hepatology, Journal of Digestive Endoscopy, and has more than 100 publications in national and international journal. Sir, we welcome you to this webinar, sir. Next, I would like to welcome Dr. Rabindranath E. He is an MBBS internal medicine and DM medical gastroenterologist, ESEG, hepatologist, gastroenterologist, and interventional endoscopy. He holds an MBBS MD internal medicine from, he holds his DM from Medical Gastroenterology, Institute of Medical Gastroenterology, Madras Medical College, Chennai. He has an MD in internal medicine, postgraduate from the Postgraduate Institute of Medical Education and Research, Chandigarh. He also did an internship for Bachelor of Medicine and Bachelor of Surgery, Government Stanley Medical College. He also holds a Bachelor of Medicine and Bachelor of Surgery from Government Stanley Medical College, Chennai. His past work experience includes, he has been the Senior Resident Internal Medicine at PGMIR Chandigarh. He was also the Registrar Gastroenterology, JN Medical College, Aligarh Muslim University, Aligarh. He has also been a consultant gastroenterology, Bellammal Medical College Hospital and Research Institute, Madurai. Currently, he is a consultant gastroenterology, Naruvi Hospitals, Vellore. Sir has more than 12 years of experience in medical services, 8 years in medical gastroenterology services, and he also holds professional membership and is a lifetime member of Indian Society of Gastroenterology and life member in Indian Medical Association. He has attended several training programs, such as a certificate course on research methodology and biostatistics 2013, Asian Young Endoscopist Award 2018 for ERCP training by IDEN, that is the International Digestive Endoscopy Network. He also has a training program in TED 2018, Advanced Endoscopy Training in Daegu, South Korea. Sir has also made many paper presentations in international and national conferences. Sir, we welcome you, sir, to this webinar today. Thank you.
Thank you.
Over to you, sir.
Now may I request IMA Delika, Chairman Sir Heguma. Yeah.
എല്ലാവർക്കും നമസ്കാരം. ആൾ ഇന്ത്യ മലയാളി അസോസിയേഷൻ എയ്മ എന്ന ഓമനപ്പേരിൽ അറിയപ്പെടുന്ന ഈ ബൃഹത്തായ സംഘടന 27 സംസ്ഥാനങ്ങളിലും യൂണിയൻ ടെറിട്ടറികളിലുമായി പടർന്നു പന്തലിച്ചു നിൽക്കുന്നു. പ്രവാസി മലയാളികൾക്ക് ഒരു താങ്ങും തണലുമാണ് എയ്മ. പ്രവാസി മലയാളികളുടെ ഒരു പരിച്ഛേദമാണ് എയ്മ എന്ന് നിസ്സംശയം പറയാൻ ഞാൻ ആഗ്രഹിക്കുന്നു. ഈ കോവിഡ് മഹാമാരിയുടെ കാലത്ത് ഇന്ത്യ ഒട്ടാകെയുള്ള എയ്മയുടെ പ്രവർത്തകർ സാമൂഹ്യ സേവനങ്ങൾ ചെയ്തുകൊണ്ടിരിക്കുന്നു. ഈ കോവിഡ് കാലത്ത് ഡൽഹിയിലും പരിസരത്തും ഓക്സിജൻ വിതരണവും മറ്റുമായി ഡൽഹി മലയാളി അസോസിയേഷൻ, DMC ഇന്ത്യ എന്നീ സംഘടനകളോട് ഒത്തുകൊണ്ട് പ്രവർത്തിക്കുകയുണ്ടായി. കോവിഡിനോടൊപ്പം തന്നെ ബ്ലാക്ക് ഫംഗസ് എന്ന രോഗവും നമ്മെ എല്ലാം ഭീതിപ്പെടുത്തുകയുണ്ടായി. സമകാലിക വിഷയങ്ങളുമായി എയ്മ എല്ലാ ശനി ഞായർ ദിവസങ്ങളിൽ വെബിനാർ നടത്തുന്നുണ്ട്. അതിന്റെ ഭാഗമായി ഇന്ന് എയ്മ ഡൽഹി COVID-19 ആൻഡ് ബ്ലാക്ക് ഫംഗസ് എ മിത്ത് ആൻഡ് റിയാലിറ്റി എന്ന വിഷയത്തിൽ വെബിനാർ നടത്തുകയാണ്. അതിൽ പങ്കെടുക്കുന്നതിനായി എയ്മയുടെ അമരക്കാരനും നമ്മുടെ എല്ലാം ആദരണീയനുമായ നാഷണൽ പ്രസിഡന്റ് ശ്രീ ഗോപാലൻ അവർകളെ ഹാർദവമായി സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. അതുപോലെ തന്നെ നമ്മുടെ എല്ലാം പ്രത്യേകിച്ച് ഡൽഹിക്കാരുടെ അഹങ്കാരവും അഭിമാനവുമായ നാഷണൽ ചെയർമാൻ ശ്രീ ബാബു പണിക്കർ അവർകളെയും ഹാർദവമായി സ്വാഗതം ചെയ്യുന്നു. നമ്മുടെ ഇന്നത്തെ വെബിനാറിന്റെ മുഖ്യ അതിഥികളും മുഖ്യ പ്രഭാഷകരുമായ ഡോക്ടർ ശ്രീ അശോക് ചാക്കോ അവർകളെയും ഡോക്ടർ രവീന്ദ്രനാഥ് അവർകളെയും അത്യധികം ആദരവോടെ സ്വാഗതം ചെയ്യുന്നു. കൂടാതെ എയ്മയുടെ നാഷണൽ അഡ്വൈസർ, നമുക്കെല്ലാം പ്രിയങ്കരനായ ശ്രീ C ചന്ദ്രൻ അവർകളെയും എയ്മയുടെ എല്ലാ കാര്യങ്ങളുടെയും ചുക്കാൻ പിടിക്കുന്ന പ്രിയപ്പെട്ട ജനറൽ സെക്രട്ടറി ശ്രീ PN ശ്രീകുമാർ അവർകളെയും ട്രഷറർ ശ്രീ RK ശ്രീധരൻ അവർകളെയും വുമൻസ് വിംഗ് ചെയർപേഴ്സൺ അഡ്വക്കേറ്റ് പ്രേമ മേനൻ അവർകളെയും ഹാർദവുമായി ഈ പരിപാടിയിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. ഇന്ത്യ ഒട്ടാകെയുള്ള എയ്മയുടെ NEC NGC അംഗങ്ങളെയും എക്സിക്യൂട്ടീവ് അംഗങ്ങളെയും ഡൽഹിയിലുള്ള എൻ്റെ സഹപ്രവർത്തകരെയും കൂടാതെ ഞങ്ങളുടെ പ്രത്യേകം ക്ഷണം സ്വീകരിച്ച് വന്നിട്ടുള്ള എല്ലാ പ്രമുഖ വ്യക്തികളെയും എയ്മ ഡൽഹിയുടെ ഈ വെബിനാറിലേക്ക് ഹാർദവമായി സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. എല്ലാവരെയും ഒരിക്കൽ കൂടി സ്വാഗതം ചെയ്തുകൊണ്ട് ഞാൻ എൻ്റെ വാക്കുകൾ ഉപസംഹരിക്കുന്നു. നന്ദി, നമസ്കാരം, ജയ് ഹിന്ദ്.
അടുത്തതായി അധ്യക്ഷ പ്രസംഗത്തിന് നമ്മുടെ പ്രസിഡന്റ് ഗോപാലൻ ക്ഷണിക്കും. ഗോപാലൻ.
ബഹുമാനപ്പെട്ട ഡോക്ടർ അശോകും ഡോക്ടർ രവീന്ദ്രനും, ഇന്ന് ഡൽഹി എയ്മയുടെ പ്രസിഡന്റായ മിസ്റ്റർ ജയകുമാർ, ശ്രീകുമാർ, RK ശ്രീധരൻ, അഡ്വക്കേറ്റ് പ്രേമ മേനോൻ, ചന്ദ്രേട്ടൻ, എല്ലാ ഭാരവാഹികളും, അതായത് നമ്മുടെ എയ്മയുടെ നെടുന്തൂണുകളായ എല്ലാ ഭാരവാഹികളെയും എക്സിക്യൂട്ടീവ് അംഗങ്ങളെയും എല്ലാം ഇന്ന് അറ്റൻഡ് ചെയ്യുന്ന എല്ലാവർക്കും എൻ്റെ വിനീതമായ നമസ്കാരം. ഇന്ന് ഏറ്റവും അതായത് ബ്ലാക്ക് ഫംഗസ്, ഇതിനെപ്പറ്റി ആധികാരികമായി സംസാരിക്കാൻ പറ്റുന്ന ഒന്നല്ല 2 ഡോക്ടർമാർ, അത് ഗാസ്ട്രോന്ററോളജിയിലെ പ്രമുഖരായ ഡോക്ടർമാർ. അവരുടെ പ്രഭാഷണങ്ങളാണ് നമ്മളെല്ലാം ആവേശത്തോടെ ഇരിക്കുന്നത്. എന്താണ് ഇപ്പം കോവിഡ് ബാധിച്ചു, ഇപ്പൊ ഒരു 1.5 കൊല്ലത്തോളമായി നമ്മള് എല്ലാരും കെട്ടിയിട്ട നിധികളെ പോലെ ഇങ്ങനെ ഇരിക്കുകയാണ്. അപ്പോ നമ്മൾ എന്ത് ചെയ്യാൻ പറ്റും എന്നുള്ള രീതിയിൽ ഇപ്പോൾ അവസാനം കണ്ടുപിടിച്ച ഈ വാക്സിനേഷൻ, അത് നമുക്ക് പൂർണ്ണമായി കിട്ടിയില്ല. കിട്ടിയാൽ ഇതെല്ലാം ശരിയാകും എന്നുള്ള വിശ്വാസമാണ്. അതിനിടയിലാണ് ഈ ബ്ലാക്ക് ഫംഗസ് എന്ന എന്നൊരു രോഗം നമുക്ക് ബാധിക്കുന്നതെന്ന് പറയുന്നത്. കാരണം കേരളത്തിൽ വളരെ കുറവാണ്. ട്രിവാൻഡ്രം മെഡിക്കൽ കോളേജിൽ 10 രോഗികൾ വന്നു, കാലിക്കറ്റിൽ ഒരാൾ മാത്രം വന്നിട്ട് ആളുകൾ മരണപ്പെടുകയും ചെയ്യും. മറ്റേ നമ്മളെ മെഡിക്കൽ കോളേജിൽ ഒരു പേഷ്യന്റ് ഇത് എത്തിയിട്ടില്ല. എന്നാലും ജനങ്ങളെ മുഴുവൻ ഭയപ്പെടുത്തുന്ന ഒന്നാണ് ഈ കാര്യം. കാരണം ബ്ലാക്ക് ഫംഗസ് എന്ന് പറഞ്ഞാൽ തന്നെ ഒരു കാര്യം കറക്റ്റായിട്ട് ഉപയോഗിച്ചില്ലെങ്കിൽ അവിടെ ഫംഗസ് വരും. അതാണ് കാര്യം. അതുകൊണ്ട് ഈ ബ്ലഡ് വെസൽസിൽ വരുന്ന ഈ ഫംഗസ്, അതായത് പിന്നെ ബ്ലഡിന്റെ മൂവ്മെന്റ് ഇല്ലാത്ത ഇടത്തില് ഈ ഫംഗസ് വരുന്നതെന്നാണ് നമ്മൾ മനസ്സിലാക്കിയത്. ആ ഫംഗസ് കൊണ്ട് നമ്മൾ എന്തൊക്കെ ഉണ്ടാകുന്നുണ്ട്, പല ലക്ഷണങ്ങളും നമുക്ക് കാണുന്നുണ്ട്. തലവേദന, പനി, മുഖത്തെ ചുവപ്പ്, ഇങ്ങനെയുള്ള പല ലക്ഷണങ്ങളും നമ്മൾ കാണുന്നു. എത്രമാത്രം നമുക്ക് ഇതിനെപ്പറ്റി അറിയുള്ളൂ. പക്ഷെ അത് ഇതിനൊക്കെ എന്തൊക്കെ വേണം, എന്തെല്ലാം പ്രതിവിധി അല്ലെങ്കിൽ സാധാരണക്കാരനൊരു മനുഷ്യൻ ഇത് വരാതിരിക്കാൻ വേണ്ടി എന്ത് ചെയ്യണം എന്നുള്ള ഒരു പഠനമാണ് നമുക്ക് കിട്ടാൻ പോകുന്നത്. കാരണം ഇത് വലിയ പ്രയോജനം എന്നുള്ള ഒരു വിശ്വാസത്തിലാണ് ഈ മലയാളി ഈ ഏമിയിലെ പ്രതിനിധികൾ മുഴുവനും ഇപ്പൊ കാതോർത്ത് നിൽക്കുന്നു. പിന്നെ അതിൽ ഇന്ന് പല രോഗങ്ങളും വരുന്നത് പിന്നെ സിറോയിഡ് പറയുന്നു. പിന്നെ ഉപയോഗിച്ച ഒരു ഉപകരണം പിന്നെ എന്തൊരു പേഷ്യന്റ് ഉപയോഗിക്കുന്നതുകൊണ്ടാണെന്ന് പറയുന്നുണ്ട്. പിന്നെ ഇതിന് ഒരു പ്രതിവിധി രോഗം ഒരു മരുന്ന് ആംഫോട്രിസിൻ ബി എന്ന ഒരു മരുന്നാണെന്നുള്ളതാണ് എൻ്റെ അറിവിൽ ഞാൻ കേട്ടിരുന്നത്. അത് അങ്ങനെ ആ മരുന്ന് ഉപയോഗിച്ചാൽ ശരിയാകും എന്നുള്ള വിശ്വാസമുണ്ട്. അതല്ല നമ്മുടെ ഭക്ഷണ രീതിയിലോ അല്ലെങ്കിൽ ഏതെങ്കിലും നമ്മളെ ജീവിത രീതിയിലോ എക്സസൈസിലോ മറ്റോ ഏതെല്ലാം പിന്നെ എക്സസൈസ് ഇത് മാറ്റാൻ പറ്റും എന്നുള്ളതൊക്കെ നമുക്ക് ഡോക്ടർ പറഞ്ഞു തരും എന്നുള്ള വിശ്വാസത്തിലിരിക്കുകയാണ്. ഏറ്റവും ഇമ്മ്യൂണിറ്റിയാണ് ഡോക്ടർ പറയാം. കാരണം സാധാരണ മനുഷ്യർ ഇമ്മ്യൂണിറ്റി ഡെവലപ്പ് എന്നുള്ളതാണ്. ഇമ്മ്യൂണിറ്റി ഡെവലപ്പ് ചെയ്യാൻ മെയിൻ ആയിട്ടുള്ള കാര്യങ്ങൾ നമുക്ക് മനസ്സിലായ കാര്യം, വർക്കൗട്ട് നന്നായി ചെയ്യണം. 75 മിനിറ്റോ 90 മിനിറ്റോ നല്ല എക്സസൈസ് ചെയ്ത് കഴിഞ്ഞാൽ നമുക്ക് ഇമ്മ്യൂണിറ്റി ഉണ്ടാവും എന്നുള്ളതാണ്. നല്ല ഭക്ഷണം, നല്ല കൃത്യമായ സമയത്ത് നല്ല ഭക്ഷണം കഴിച്ചാൽ നമുക്ക് ഇമ്മ്യൂണിറ്റി കിട്ടും. എക്സസൈസ് ചെയ്യണം, പിന്നെ നല്ല വിശ്രമം വേണം. ഇതൊക്കെയാണ് നമ്മൾ പഠിച്ചു വെച്ചത്. ഇതിൽ കവിഞ്ഞ് സാധാരണക്കാരന് കൂടുതൽ മനസ്സിലാക്കാൻ നമുക്ക് പ്രയോജനപ്പെടുന്ന ഒരു പ്രഭാഷണ രീതിയായിരിക്കും നമ്മുടെ ഇന്നത്തെ ഡോക്ടർമാർ, നമ്മുടെ അശോക് സാറും ഡോക്ടർ രവീന്ദ്രനും ഇവിടെ ഇന്ന് നമുക്ക് പറഞ്ഞു തരാം. അത് കാതോർത്ത് വളരെ ശ്രദ്ധിച്ച് നമ്മൾ നോട്ട് ചെയ്ത് നമ്മുടെ ജീവിതത്തിൽ പകർത്തിയാൽ നമുക്ക് ഒരു രോഗങ്ങളും നമ്മൾ ഭയപ്പെടാൻ പോകുന്ന ഒരു രോഗങ്ങളും നമുക്ക് ഉണ്ടാവില്ല എന്നാണ് എൻ്റെ വിശ്വാസം. നമ്മുടെ മൊത്തത്തിൽ നമ്മുടെ ലൈഫ് സ്റ്റൈല് മാറ്റണം. അതാണ് മെയിൻ. ലൈഫ് സ്റ്റൈല് നല്ല കൃത്യമായ ഒരു ലൈഫ് സ്റ്റൈൽ നമുക്ക് ഉണ്ടാക്കണം. ഉണ്ടായിക്കഴിഞ്ഞാൽ ഒരു രോഗം ഉണ്ടാവുകയില്ല എന്ന് സാധാരണക്കാർ പറയുന്നുണ്ടെങ്കിലും അത് ഇന്റേണലായിട്ട് നമ്മൾ കടന്ന് അത് എല്ലാം മനസ്സിലാക്കാനുള്ള ഒരു പ്രത്യേക താല്പര്യം മലയാളികൾക്കുണ്ട്. അത് ഇപ്പൊ നമ്മൾ അതിന് കൊണ്ടാണ് ഇങ്ങനെ കൊറോണയെ പറ്റി പല ഡോക്ടർമാരോട് സംസാരിച്ചു, പല ദിവസങ്ങളോളം നമ്മൾ സംസാരിച്ചു. പക്ഷെ ഇത് ഒരു വ്യത്യസ്തമാണ്. നമ്മളെ ബ്ലാക്ക് ഫംഗസ്, അതാണ് നമ്മൾ അറിയാൻ പോകുന്നത്. ഞാൻ കൂടുതൽ നീട്ടുന്നില്ല. ഒരു നല്ല പ്രഭാഷണത്തിന് വേണ്ടി നമുക്ക് എല്ലാവർക്കും വെയിറ്റ് ചെയ്യാം. നന്ദി, നമസ്കാരം.
നമ്മുടെ ഐമ നാഷണൽ ചെയർമാൻ മിസ്റ്റർ ബാബു പണിക്കർ, പ്ലീസ്.
ആദരണീയനായ നമ്മുടെ പ്രസിഡന്റ് ശ്രീ ഗോകുലം ഗോപാലേട്ടൻ, ആദരണീയനായ ഇന്നത്തെ മുഖ്യാതിഥികളായ പ്രൊഫസർ ഡോക്ടർ അശോക് ചാക്കോജി, ആദരണീയനായ ഡോക്ടർ രവീന്ദ്രനാഥൻജി, നമ്മുടെ ആദരണീയനായ ജനറൽ സെക്രട്ടറി ശ്രീ PN ശ്രീകുമാർജി, ആദരണീയനായ ട്രഷറർ ശ്രീ RK ശ്രീധരൻജി, നമ്മുടെ ആദരണീയനായ അഡ്വൈസർ ശ്രീ C ചന്ദ്രൻജി, ആദരണീയായ വുമൺ ചെയർപേഴ്സൺ അഡ്വക്കേറ്റ് ശ്രീമതി പ്രേമ മേനോൻജി, സീനിയർ ആയിട്ടുള്ള നമ്മുടെ RS പിള്ളജി, ഇന്ന് ആദരണീയനായ ഞാൻ കുട്ടപ്പൻജിയെ കണ്ടു, നമ്മുടെ ഡൽഹി പ്രസിഡന്റ് ശ്രീ ജയകുമാർജി, ശ്രീ P രവീന്ദ്രൻജി സെക്രട്ടറി, അങ്ങനെ ഡൽഹിയിലെ സഹപ്രവർത്തകരെ, ആദരണീയായ എയ്മയുടെ എല്ലാ സംസ്ഥാനങ്ങളിലെയും സംഘടനാ സാരഥികളെ, സഹപ്രവർത്തകരെ, കുടുംബാംഗങ്ങളെ, നിങ്ങൾക്കെല്ലാം എൻ്റെ വിനീതമായ നമസ്കാരം. നമുക്ക് ഇന്ന്, കാരണം കഴിഞ്ഞ കുറെ വർഷങ്ങളായിട്ട് നമ്മൾ കോവിഡിനെ കുറിച്ച് മാത്രമാണ് ചർച്ച ചെയ്തുകൊണ്ടിരുന്നത്. അപ്പൊ കോവിഡ് കഴിഞ്ഞപ്പം ഇപ്പം ബ്ലാക്ക് ഫംഗസ് ആയി. ഗോപാലേട്ടൻ വളരെ വിശദമായിട്ട് ബ്ലാക്ക് ഫംഗസിനെ കുറിച്ച് പറയുകയുണ്ടായി. ഇത് ബ്ലാക്ക് ഫംഗസിന് ഈ കളറ് ഒന്നുമില്ല. ഇതിന് സ്കിന്നിൽ ചെന്ന് കഴിയുമ്പോൾ സ്കിൻ ബ്ലാക്ക് ആവുന്നതുകൊണ്ടാണ് ഇതിനെ ബ്ലാക്ക് ഫംഗസ് എന്ന് പറയപ്പെടുന്നത്. നമ്മുടെ നോസിൽ കൂടി ഉള്ളിലോട്ട് പോയി കഴിഞ്ഞ് കഴിയുമ്പം ഫംഗസ് വന്നു ഇത് കൂടുതൽ അനുഭവപ്പെടുന്നത് എൻ്റെ പരിമിതമായ അറിവ് വെച്ച് നോക്കിക്കഴിഞ്ഞാൽ ഇത് ഒന്ന് ഡയബറ്റീസ്, പിന്നെ സ്റ്റീരോയിഡ് ഉപയോഗിക്കുക, അങ്ങനെയുള്ള പേഷ്യൻറ്റിലാണ് ഇത് കൂടുതലും. ഓക്സിജൻ എടുക്കുന്ന പേഷ്യൻസിന് അങ്ങനെയാണ് ഇത് കൂടുതലും വരുന്നത്. ഇത് ഓക്സിജന്റെ ഈ ഹ്യൂമിഡിഫയറിൽ കൂടെ അല്ലെ പൈപ്പിൽ കൂടെ ക്ലീൻ ഇല്ലാത്തതാണ് ഫംഗസ് നോസിൽ കിടക്കുകയും നോസിൽ നിന്ന് ലങ്സിൽ പോവുകയും ത്രോട്ടിൽ നിന്ന് ലങ്സിൽ പോവുക, അല്ലെങ്കിൽ നോസിൽ നിന്ന് അയിൽ നിന്ന് ബ്രെയിനിലോട്ട് കിടക്കുകയോ ചെയ്യുന്നത്. ഇത് ബ്ലഡിനെ ബ്ലോക്ക് ചെയ്യുകയും ബ്ലഡ് സർക്കുലേഷൻ നിന്ന് പോവുകയും ചെയ്യുമ്പോൾ ആ സ്ഥലത്ത് ഇൻഫെക്ഷൻ ഉണ്ടാകുകയും, ആ സ്ഥലത്ത് ഇൻഫെക്ഷൻ ഉണ്ടാകുന്ന സ്ഥലത്താണ് ബ്ലോക്ക് ആകുന്നത്. പിന്നെ രക്തം അങ്ങോട്ട് സംക്രമിക്കാതിരിക്കുമ്പോൾ ആ സ്ഥലം ഡെഡ് ആകുകയാണ്. അവിടെ ആ സെല്ലിനെ കില്ല് ചെയ്യുകയാണ്. അവിടെ പിന്നെ ആ ഭാഗം ഒന്നും ആ രീതിയിലോട്ടുള്ള ഒരു അസുഖമായിട്ടാണ് ഇത് കണക്ക് കൂട്ടുന്നത്. നമ്മൾ ഈ പ്രമേഹം എന്ന് പറയുമ്പോൾ തന്നെ മലയാളത്തിൽ പ്രമേഹം എന്ന് പറയുന്നത് നമുക്ക് ഈ ഇമ്മ്യൂണിറ്റി കുറഞ്ഞു പോകുന്നതുകൊണ്ടാണ്. ആദ്യമേ ഇമ്മ്യൂണിറ്റി കുറവാണ്, പിന്നെ സ്റ്റീരിയോയിഡും പിന്നെ കോവിഡും കൂടെ വന്നു കഴിയുമ്പോൾ ഇത് ഉപയോഗിക്കുന്നതുകൊണ്ട് ഇമ്മ്യൂണിറ്റി ഏറ്റവും വളരെ താഴ്ന്നുകൊണ്ടാണ് ഈ അസുഖം പല ആൾക്കാർക്കും വരുന്നത്. തീർച്ചയായും നമ്മൾ അതിന് വേണ്ടിയിട്ട് എപ്പോഴും ശുചിത്വമായിട്ടിരിക്കുക. ഓക്സിജൻ എടുക്കുന്ന പൈപ്പ് വളരെ വൃത്തിയായിട്ട് സൂക്ഷിക്കുക. ഹ്യൂമിഡിഫയറിലെ വെള്ളം എപ്പോഴും മാറ്റിക്കൊണ്ടിരിക്കുക. ഒരുപാട് പ്രിക്കോഷൻസ് നമുക്ക് പേഷ്യന്റ് കൊടുക്കേണ്ടത്. ഇത് കാരണം ഇത് ആൾക്കാർക്ക് ആദ്യം അറിയാത്ത വളരെ COVID-19 ട്രീറ്റ് ചെയ്ത പല ആൾക്കാർക്ക് ഈ അസുഖം ഡൽഹിയിലൊക്കെ വളരെ വ്യാപകമായിട്ട് ഈ അസുഖം വന്നിട്ടുണ്ട് പലർക്കും. കാരണം ഡൽഹിയിൽ ഏറ്റവും കൂടുതൽ ഓക്സിജൻ ഉപയോഗിച്ചാണ് ആൾക്കാർ. നമുക്ക് ഇത് എങ്ങനെ തടഞ്ഞു നിർത്താൻ സാധിക്കും? ഇനിയും ചിലപ്പോൾ തേർഡ് വേവ് വരുന്നുണ്ടെന്ന് പറയുന്നു. ആ തേർഡ് വേവ് വരുന്ന സമയത്ത് നമുക്ക് ഡോക്ടർമാരുടെ ഉപദേശം, ഇത്രയും ഇതിനെക്കുറിച്ച് കൂടുതൽ ആധികാരികയോടെ പറയാനുള്ള ഡോക്ടർമാരുടെ ശ്രീ പ്രൊഫസർ അശോക് ചാക്കോജിയും ഡോക്ടർ രവീന്ദ്രനാഥിന്റെ ഉപദേശം നമുക്ക് സ്വീകരിച്ചുകൊണ്ട് ഇത് എങ്ങനെ തടഞ്ഞു നിർത്താൻ സാധിക്കും? അസുഖം വന്നു കഴിഞ്ഞാൽ ട്രീറ്റ് ചെയ്യുന്നതിനെ കുറിച്ച് ഒരു കാര്യമില്ല. കാരണം ഇത് വന്നു കഴിഞ്ഞാൽ ഇപ്പം അവിടെ ഇതിന്റെ ഏറ്റവും വലിയൊരു അനുഭവസ്ഥനായിട്ടുള്ള ചന്ദ്രേട്ടൻ ഇവിടെ ഉണ്ട്. ചന്ദ്രേട്ടൻ ആ ഒരു കടന്നുപോയ വഴികൾ എന്ന് പറഞ്ഞാൽ നമുക്കൊന്നും ആലോചിക്കാൻ കൂടെ പോയില്ല, സങ്കല്പിക്കാൻ പറ്റാത്ത വഴിയിൽ കൂടെയാണ് അദ്ദേഹം കടന്നുപോയത്. എന്നിട്ട് ഇത് അസുഖം വരുന്നതിന് മുമ്പ് എങ്ങനെ തടഞ്ഞു നിർത്താം? ഡോക്ടറോട് നമുക്ക് ചോദിക്കാൻ സാധിക്കും. എങ്ങനെ നമുക്ക് ഈ അസുഖം വരാതിരിക്കാനായിട്ട് നമ്മൾ എന്തെല്ലാം സ്റ്റെപ്പുകൾ എടുക്കണം, എങ്ങനെയൊക്കെ നമ്മൾ വൃത്തിയായിട്ട് ഈ കാര്യങ്ങളൊക്കെ സൂക്ഷിച്ചു വെക്കാൻ നമുക്ക് സാധിക്കും. അതിന് വേണ്ടിയിട്ടുള്ള മാർഗനിർദ്ദേശങ്ങളൊക്കെ രണ്ട് ഡോക്ടർമാരും നമുക്ക് തരുമെന്ന് വിചാരിക്കുന്നു. അതിൽ ഏറ്റവും അനുഭവസ്ഥന്മാരായ 2 ഡോക്ടർമാരാണ്. നമുക്ക് വെല്ലൂർ മെഡിക്കൽ കോളേജിൽ നിന്നൊക്കെ ഇത്രയും പ്രാക്ടീസും ഇത്രയും അനുഭവ ജ്ഞാനമുള്ള ഒരു ഡോക്ടർ നമുക്ക് വേണ്ടി ഇത്രയും സമയം മാറ്റിവെക്കുന്നത് തന്നെ തീർച്ചയായിട്ടും നമുക്ക് എയിമയ്ക്ക് ഏറ്റവും വലിയ അനുഗ്രഹമായിട്ട് തന്നെ പറയാം. നമ്മൾ ഇതിൽ പങ്കെടുക്കുന്ന ഡോക്ടറോട് പ്രത്യേകിച്ച് ഒരു കാര്യം പറഞ്ഞാൽ, ഇതിൽ പങ്കെടുക്കുന്ന എല്ലാം ഓരോ സംസ്ഥാനത്തെ ഭാരവാഹികളാണ്. ഈ ഭാരവാഹികൾ അതാത് സംസ്ഥാനങ്ങളിൽ ഡോക്ടർ അറിവുകൾ നമുക്ക് ഷെയർ ചെയ്യാൻ സാധിക്കും. നമ്മൾ വാട്സാപ്പിലും മറ്റുള്ള മീഡിയത്തിൽ കൂടെ ഷെയർ ചെയ്യാൻ സാധിക്കും. അന്നേരം ഒരുപാട് ആൾക്കാർക്ക് ഇതിന്റെ ഡോക്ടറുടെ ഈ അറിവ് പകർന്നു തരുന്നതുകൊണ്ടുള്ള പ്രയോജനം ഉണ്ടാകും. അത് ഇന്ത്യ മുഴുവൻ ഇത് പറഞ്ഞു കൊടുക്കാൻ, ഇത് മുഴുവൻ എത്തിക്കാനും ഞങ്ങൾക്ക് സാധിക്കും. ആ ഒരു അറിവ് പകരാൻ ഞങ്ങൾക്ക് തന്ന സമയത്തിന് എന്നും എയിമ കടപ്പെട്ടിരിക്കും. ഒരിക്കൽ കൂടി എല്ലാവരെയും സ്വാഗതം പറഞ്ഞുകൊണ്ട് ഞാൻ എൻ്റെ വാക്കു ഉപസംഹരിക്കുന്നു. നന്ദി. നമുക്കെല്ലാം രോഗമുക്തമായിട്ടുള്ള ഒരു ഭാവി കാലത്തെ പ്രതീക്ഷിച്ചുകൊണ്ട് എല്ലാവർക്കും നമസ്കാരം. താങ്ക് യു വെരി മച്ച്.
താങ്ക് യു ബാബു പണിക്കർ സാർ. നൗ നമ്മുടെ അഡ്വൈസർ മിസ്റ്റർ ചന്ദ്രൻ 2 വാക്ക് സംസാരിക്കും.
സംസാരിച്ചോളൂ ചന്ദ്രൻ.
മ്യൂട്ട്.
സംസാരിച്ചോളൂ.
കേൾക്കുന്നുണ്ടല്ലോ?
കേൾക്കുന്നു.
നമ്മുടെ ആയ്മയുടെ ആരാധ്യനായ പ്രസിഡന്റ് ശ്രീ ഗോകുലം ഗോപാലൻ ചേട്ടൻ ഇന്ന് നമ്മളോട് സംസാരിക്കുന്ന ബ്ലാക്ക് ഫംഗസിനെ പറ്റിയിട്ട് നല്ലൊരു വിവരം തരുന്ന പ്രൊഫസർ ഡോക്ടർ അശോക് ചാക്കോ, ഡോക്ടർ രവീന്ദ്രനാഥ്, ആയ്മയുടെ അഡ്വൈസറും എൻ്റെ ഉത്തമ സുഹൃത്തുമായ ബാബു പണിക്കർ, ആയ്മയുടെ ഡൽഹി ഘടകം പ്രസിഡന്റ് മിസ്റ്റർ ജയകുമാർ, സെക്രട്ടറി രവി, അതോടൊപ്പം തന്നെ നമ്മുടെ പ്രിയങ്കരനായ ജനറൽ സെക്രട്ടറി ശ്രീകുമാർ ആൻഡ് ശ്രീധരൻ, മറ്റു ആയ്മയുടെ ലേഡീസ് വിംഗ് പ്രസിഡന്റ് അഡ്വക്കേറ്റ് പ്രേമ മേനോൻ, മറ്റു എല്ലാ ഭാരവാഹികളെ, സുഹൃത്തുക്കളെ, എല്ലാവർക്കും എന്നെ വിനീതമായ ഒപ്പുപോയി. തീർച്ചയായിട്ടും ഞാൻ ഇന്നത്തെ മീറ്റിംഗിൽ വന്നത് ഈ ബ്ലാക്ക് ഫംഗസ് വന്നിട്ട് ശരിക്കും അനുഭവപ്പെട്ട മരണം മുഖാമുഖം കണ്ടുകൊണ്ട് ഡോക്ടർമാർക്കടക്കം സംശയമായിരുന്നു ഞാൻ തിരിച്ചു വരുമെന്നുള്ളത്. ഡോക്ടർമാരടക്കം പറഞ്ഞത് അറിയിക്കേണ്ട ആൾ അറിയിച്ചോളാം. പക്ഷെ ഞാൻ അന്നേരം ധൈര്യം ഒട്ടും കൈവെടിഞ്ഞിട്ടില്ല. പക്ഷെ നമ്മൾ ധൈര്യം മാത്രം പോരാ. നേരത്തെ ബാബു പറഞ്ഞ പോലെയും ഗോപാലേട്ടൻ പറഞ്ഞ പോലെയും നമ്മൾ ചെയ്യേണ്ടതായ പല കാര്യങ്ങളും ചെയ്താൽ മാത്രമേ ഈ ബ്ലാക്ക് ഫംഗസിൽ നിന്ന് രക്ഷപ്പെടാൻ പറ്റൂ. അതിപ്പോ ഞാൻ പറയുന്ന ഒരു അർത്ഥമില്ല, നമ്മുടെ ഡോക്ടർമാർ നമ്മളോട് പറയും. പക്ഷെ ഞാൻ രക്ഷപ്പെട്ടത് എന്തുകൊണ്ടാണെന്ന് വെച്ച് കഴിഞ്ഞാൽ, ആർമി ഹോസ്പിറ്റല് എനിക്ക് എന്തോ തോന്നി, ഞാൻ എക്സ് സർവീസ് മാനിന്റെ പേരില് പെട്ടെന്ന് തന്നെ ആർമി ഹോസ്പിറ്റൽ എമർജൻസി വാർഡില് എമർജൻസിയിൽ എത്തുക എന്നുള്ളത്. അവിടെ എത്തിയപ്പോ തന്നെ ആ 2-3 ലേഡി ഡോക്ടർക്ക് എൻ്റെ മൂക്കിന്ന് വന്ന ഒരു ബ്ലാക്ക് ഫംഗസിന്റെ ബ്ലാക്കും ഉള്ളിൽ വൈറ്റുമായിട്ടുള്ള ഒരു സാധനം ഞാൻ ഡോക്ടർക്ക് കൊടുത്തു. അപ്പൊ എവിടുന്ന് വന്നപ്പോ എന്നോട് പറഞ്ഞത് ഞാൻ മൂക്കുന്നാന്ന് പറഞ്ഞു. അപ്പൊ അവർക്ക് ഇതിന്റെ റൂട്ട് അധികം കണ്ടുപിടിക്കേണ്ട ആവശ്യമുണ്ടായില്ല. ഞാൻ കോവിഡ് കഴിഞ്ഞിട്ട് കറക്റ്റ് കോവിഡ് 28-ാം തീയതി എൻ്റെ കോവിഡ് കഴിഞ്ഞ് 29 മുതൽ എനിക്ക് കണ്ണുവേദന തുടങ്ങിയപ്പോഴാണ് ഞാൻ ഇവിടെ നല്ലൊരു ഐ സ്പെഷ്യലിസ്റ്റിനെ കൊണ്ട് കാണിച്ചപ്പോഴേ അവർക്കൊന്നും മനസ്സിലായില്ല. പിന്നെ ഞാൻ ആർമി ഹോസ്പിറ്റലിൽ പോയി. എനിക്ക് വേണ്ട എന്തോ അവിടെ എനിക്ക് തോന്നി. ഞാൻ അവിടെ പോയി എനിക്ക് കിട്ടിയ ആ ട്രീറ്റ്മെന്റുകൾ എത്രയോ വലുതാണ്. അതിൽ നിന്ന് ഞാൻ തിരിച്ചു വന്നു. അതെന്റെ കാര്യമാണ്. പക്ഷെ ഡോക്ടർ അശോക് സാറും ഡോക്ടർ രവീന്ദ്രനാഥ് സാറും പറഞ്ഞാൽ നമുക്ക് തീർച്ചയായിട്ടും നമുക്ക് എന്ത് ചെയ്യണം എന്നുള്ളതാണ്. ഇപ്പൊ ഈ സംഗതി ഫംഗസ് വന്നു കഴിഞ്ഞാല് ചിലപ്പോൾ നമ്മള് 3 മാസം 4 മാസം മരുന്നൊക്കെ കുടിക്കേണ്ടി വരും. അതൊക്കെ വളരെ കോസ്റ്റ്ലി എഫേഴ്സ് ആണ്. ഇപ്പൊ ഞാൻ കഴിച്ചുകൊണ്ടിരിക്കുന്ന മരുന്നാണ് പോസോകോണോസോ. ഒരു ദിവസം 300 mg ഡെയിലി കഴിച്ചുകൊണ്ടിരിക്കുകയാണ്. അപ്പൊ അതൊക്കെ കുടിക്കുമ്പോൾ തീർച്ചയായിട്ടും ബോഡിക്കുള്ള വീക്ക്നെസ് ഉണ്ട്. ഭക്ഷണത്തില് ഒരു ഷുഗർ പേഷ്യന്റ് എന്നുള്ള നിലയിൽ ഭക്ഷണത്തിൽ പല ലിമിറ്റേഷനും ഉണ്ട്. അതോടൊപ്പം തന്നെ എനിക്ക് ലിവറിന് ഇതുവരെ ഒരു പ്രോബ്ലം ഇല്ലായിരുന്നു. ഡോക്ടർമാർക്ക് അവർക്ക് തന്നെ അതിശയം, ലിവറിന് ഒരു ചെറിയ പ്രോബ്ലം, വളരെ മൈനർ പ്രോബ്ലം 2 പ്രാവശ്യം എൻഡോസ്കോപ്പി ചെയ്ത് ഞാനും ചെയ്തിരുന്നു. അപ്പൊ അവർ പേടിക്കാനൊന്നുമില്ല, അങ്ങനെ യാതൊരു പ്രോബ്ലം ഇല്ല. പ്രത്യേകിച്ച് ഇന്ന് ഗാസ്ട്രോളജിയുടെ ഡോക്ടർമാരാണ് ഇവിടെ പറയുമ്പോൾ എന്തുകൊണ്ടാണ് അങ്ങനെ വന്നതെന്നും കൂടി എനിക്കറിയാൻ പറ്റും. അതുകൊണ്ടാണ് ഞാൻ പ്രത്യേകം എത്ര വയ്യായിട്ട് കൂടി ഫംഗ്ഷനിൽ ഇതിൽ ഞാൻ പങ്കെടുക്കുന്നത്. പിന്നെ ഐമയെ പറ്റി പറയുകയാണെങ്കിൽ അടുത്ത കാലത്തായിട്ട് ഐമ ചെയ്ത പ്രവർത്തനങ്ങൾ, പ്രത്യേകിച്ചിട്ട് ഗോകുലം ഗോപാലേട്ടന്റെ നേതൃത്വത്തിൽ ഞാനിത് ഹോസ്പിറ്റലിൽ 2 മാസമായിട്ട് ഹോസ്പിറ്റലും ഇതൊക്കെ ആണെങ്കിൽ കൂടിയും ഹോസ്പിറ്റലിൽ നിന്നൊക്കെ വന്ന് ഞാൻ വീട്ടിലിരുന്നപ്പോഴ് എനിക്ക് ഒരു കണ്ണിന്റെ കാഴ്ച എന്നിൽ നിന്ന് നഷ്ടപ്പെട്ടു എന്നുള്ളത് വലിയൊരു വിഷമമുള്ള കാര്യം തന്നെയാണ്. പക്ഷെ അതൊന്നും എൻ്റെ ധൈര്യത്തിൽ നിന്ന് പിന്നോട്ട് മാറിയിട്ടില്ല. എങ്കിലും ഞാൻ എല്ലാ കാര്യങ്ങളിലും വീട്ടിലിരുന്നു കൊണ്ട് നോക്കുമ്പോൾ എന്താണ് ഐമ എന്താണ് മറ്റുള്ള സംഘടനകൾ ചെയ്തത് എന്നുള്ളത് എനിക്ക് മനസ്സിലാക്കിയപ്പോൾ എനിക്കതിൽ പങ്കെടുക്കാൻ കഴിഞ്ഞില്ല എന്നുള്ളൊരു ദുഃഖം മാത്രമേ ഉണ്ടായിരുന്നു. പക്ഷെ എങ്കിലും ഇതൊക്കെ ചെയ്തല്ലോ എന്നുള്ളൊരു സന്തോഷം എനിക്കുണ്ട്. പ്രത്യേകിച്ചൊരു ഗോപാലേട്ടന്റെ നേതൃത്വത്തില് ഇത്രയും വലിയ കാര്യങ്ങൾ, പ്രത്യേകിച്ചായിട്ട് അദ്ദേഹം പറഞ്ഞു സിലിണ്ടറിന്റെ കാര്യമൊക്കെ പറഞ്ഞു, പല കാര്യങ്ങളും, ഒരു കാര്യങ്ങൾ മാത്രമല്ല. അപ്പൊ അതിന് തീർച്ചയായിട്ടും ഈ ഐമയുടെ പ്രസിഡന്റിനെ അഭിനന്ദിക്കുന്നതോടൊപ്പം തന്നെ ഐമയുടെ എല്ലാ ഭാരവാഹികളും അഭിനന്ദിച്ചുകൊണ്ട് എൻ്റെ വാക്കുകൾ ചുരുക്കുന്നു. നമ്മുടെ അശോക് സാറിന്റെയും രവീന്ദ്രനാഥ് സാറിന്റെയും പ്രസംഗം കേൾക്കാൻ വേണ്ടിയിട്ട് ഞാൻ വെയിറ്റ് ചെയ്യാണ്. എല്ലാവർക്കും എൻ്റെ നമസ്കാരം. ജയ് ഹിന്ദ്.
താങ്ക് യു ചന്ദ്രൻ. അടുത്തതായി നമ്മുടെ ഇതുവരെ എല്ലാവരും ആകാംക്ഷയോടെ കാത്തിരിക്കുന്ന അശോക് സാറും ടീമിന്റെ പ്രഭാഷണം ആരംഭിക്കുകയാണ്. സർ, അശോക് സാർ പ്ലീസ്.
Mr. Gokulam Gopalan, President IMA, Mr. Babu Panikkar, Chairman IMA, Mr. Sri Kumar, General Secretary IMA, Mr. Chandran, Advisor, National Advisor, and a survivor of black fungus, the various office bearers and members of IMA. I'd first like to thank the office bearers of IMA for having invited me to this webinar on black fungus in COVID-19 infection. Before going into my presentation, I would like to share with you all an incident that happened just about 1 year ago. In March 2020, my wife and I went for a holiday to Australia and New Zealand, and we landed back in Delhi and were told at the airport that we have to be quarantined. We were housed at the Holiday Inn at AeroCity, and it was a quarantine. And a couple of days later, this is something we didn't expect. So a couple of days later, we realized that we were going low in medicines. I couldn't go out because I was quarantined. There was a lockdown, so nobody could come to the hotel. And I tried to call some of my friends in Chennai, Vellore, other places. And one of my dear friends, Matthew, introduced me to Mr. Ravindran. So Ravi told me that he can't come, but he will try to get me the medicines. And he was able to do it for me through Dr. Cherian, the chairman of Kerala Roadways, chairman DMA, Mahip Palpur. So he was able to get me those medicines, which was very important at that time. So a big thank you to Dr. Cherian. So once the quarantine was over, we were COVID negative, and they told us you can go home. But how do we go home? It is a lockdown. There were no flights, no trains, and we were stuck there for the next 25 days. And we didn't know how long we were going to be stuck there. At the end of 25 days, we became a bit desperate and wondering what to do. Then Ravi told me, there's one option. Maybe you can go by road. The IMA has sent 2 buses to Kerala. There was some difficulty, but they have reached. I was horrified thinking of the road journey during this lockdown from Delhi all the way to Chennai. And I expressed to him my fears. He discussed the matter with Mr. Babu Panikar. And they told me that they will help, IMA will help. And he promised that he'll give me a vehicle, 2 drivers, and he said they would make the itinerary for me, as well as they promised to give food and water along the way up to Chennai through the IMA representatives from each state. So we thought about it, and finally there was no other way out. So we decided to go. But he also said that you will be stopped on the way at various places. And that is something that I may not be able to help you. You have to manage on your own. So we took the plunge and we started. There was one other person I should also thank. He's not from IMA, but his name is Mr. Anand Mohan. Anand Mohan was the Deputy Commissioner of Delhi at that time and a good friend of mine. His father and father-in-law were my patients. So he actually, as well as Mr. Babu Panikar, helped in the documents that I had to get. He sent 2 policemen to help out, which also was useful. And we started. And as expected, we were stopped all along the way. We had to go through, I think, 7 states. And it was a very, very tiresome, difficult journey. Again, at each point where we stopped, one person who really helped was Mr. Anand Mohan. He would call the SP of that area, speak to them, get us through. And also Mr. Babu Panikar used his influence to get us through many other places. So with this, we were able to move forward and we reached Chennai. But one group was very, very important. Throughout our journey, in each state, the members of the AIMA brought food and water to us. It was all home cooked food because there was no food outside. I mean, only if you travel, you will realize that there was no restaurant. There was no tattakada even. There was no hotels. Nobody would take you in. And while we went, we saw hundreds of migrant workers traveling with luggage, without food, in the hot sun. We were traveling in an air-conditioned vehicle, and we were finding it difficult to travel all the way. So, I mean, the unimaginable plight of these people. And only thing we could do for them was to help them because a lot of food was given to us. So whatever extra food was there, which is a lot of it, we did give it to all these migrant workers who were doing. So I have to really thank all those angels of AIMA who helped us through each state as we progressed. So today I would like to thank from the bottom of my heart Mr. Babu Panikkar, Mr. Ravi, and all Mr. Sri Kumar, who made the itinerary for us, and also all the members of AIMA who like angels helped us along the way up to Chennai. So thank you very much.
Thank you, Doctor.
Now I'll go into my, thank you. Now I'll go into my presentation. The topic that was given to me was COVID-19 and black fungus, myth and reality. What I will do in the next half an hour or so is to first tell you about the enigma of COVID-19. Enigma is a mystery, something you don't understand. I will give you some reasons why I feel that this whole COVID-19 is an enigma. Then I will speak on COVID-19 and black fungus. I will try to answer some questions. What is black fungus? What are the risk factors for developing the black fungus? Why was there a surge in black fungus infection during the second wave of COVID? How does it spread? What are the symptoms? How do we diagnose it, treat it? And as mentioned by the previous speakers, how do we prevent the disease? How serious is the disease? And finally end with some myths associated with black fungus and COVID-19. I think it's very important to look at the general scene before we move forward. As of June 17th of this year, there has been about 18 crores of people all over the world who have developed or been infected with COVID-19. And about 38 lakhs have passed away. There are about 3 crores of people who have been infected in India, and about close to 4 lakhs have died. India has the second highest number of infection rates and the third highest number of deaths from COVID in the world, in India. This slide is mainly to show you the cases and the deaths that have happened in the first wave and in the second wave. And you will find that definitely there have been much more number of cases and deaths in the second wave as compared to the first wave. Now going on to why I said that COVID-19 is an enigma. It's a mystery, something that you don't understand properly. Even when you look at the origins of the virus, we are not sure where it came from. Did it come from a virology research center in Wuhan, China? They've been working on these coronaviruses. Did some virus escape, come into the atmosphere, infect the people in Wuhan, and then from other parts of China, they travel all around the world, and we get a pandemic. The Chinese don't agree to it. Initially, the scientists felt it's not true. The conspiratory theory is not correct. They felt, no, can we go to the previous slide? They felt that it was coming from the bat. The bat from the wet market of Wuhan, the bat meat was eaten by people there, and they got infected, and they transmitted it to other people, and from there it went all around. The second enigma is about the virus itself. We knew that there was a virus in March 2020. Then in September 2020, the first mutant virus or the variant came from the United Kingdom. In October 2020, we had a South African variant and an Indian variant. And in December 2020, we had a variant in Brazil. What is the problem with these variants? One, these variants are more transmissible. They got more infected, more number of patients get infected. They have increased severity of the disease. There is more oxygen requirement. There is more ICU care needed. There are more deaths. And the vaccine efficacy is also decreased in these variants. So from March 2020 to now, the virus has been changing, and therefore it is a problem. What about the treatment protocols? In the first wave, we used to treat patients with hydroxychloroquine, antibiotics, ivermectin, plasma therapy. They said all this is useful. Now they say that there is no use of treating with all these. There are other treatments. So next we see about the vaccine policy. That is also changing. Initially for Covishield, it was said that you need to give 4 weeks between 2 doses. In fact, when I took Covishield, I had a 4-week gap. Then they said it should be 6 to 8 weeks. Then 8 to 12, 12 to 16 weeks. Now in UK, they have changed it. It's back to 4 to 6 weeks. So the interval keeps changing. And when they started giving the vaccine, they said that there would be 2 doses and then you would be protected. But now we see that from a recent CMC study, which was still in print, which came out a couple of days ago, they have found that 10% of those who had 2 doses had a recurrent disease. But the good news is the disease is mild and there were no deaths. Also now they say you need a booster. 2 doses are not enough. Within 6 months, your antibody levels go down. You need a 3rd injection. Again, a change of goalposts regarding the vaccine policy. When you get an influenza virus infection or any other viral illness, the illness comes and then the illness goes away. They don't have problems once the illness goes away. But in COVID, there are long-term problems, or they're called long-haul COVID problems. Even about 1/3 of the patients after COVID, they keep getting symptoms. So why do they get symptoms? We don't know. But this is another major problem, which will be addressed by Dr. Ravindranath later. We had 1 wave, we had a 2nd wave. Now they say 2 weeks later, we are going to have, 2 months later, we are going to have a 3rd wave. There's already been a 3rd wave in England, Europe, and Brazil. Will there be a 4th wave, 5th wave? Where is it going to end? What about the way we live in future? Will it change? Once COVID comes down, will it be the same as earlier? Will working from home continue? Will the children have some online classes. Nowadays, most businesses, as well as like our webinar, is web-based. How will the travel be? Again, we do not know. It is an enigma. There is also a surge in black fungus that has happened during the second wave. During the first wave, we didn't get black fungus. There's hardly any black fungus, whereas there is a surge in the second wave. Why did it happen? So when you look at all these things, what we thought was COVID and how it behaved, it's changing its goalpost. It is different. And this is the major problem that doctors are facing. We do not know who is going to be bad when a person gets an infection, who is going to have a severe infection, who is going to have a mild infection. We are not very sure. Initially, it was said that all the sick people, the older people, they are the people who will get infected and have a bad prognosis. But now what we find, young people, 30 years, 40 years, they are getting severe infection and they are dying. So it is an unpredictable form of disease. That is the big headache that doctors face. So for the rest of my talk, we will concentrate on this black fungus during the second wave. And I think that's what most of you are waiting to hear. More than 30,000 people in India have been infected with black fungus. We don't have proper data on the number of deaths. As you see here, most of the states in India, we have reported black fungus infection. When the same infection is reported at the same time all over the country, it is called an epidemic. So we can say there is an epidemic of black fungus during a pandemic of COVID-19 in India. And being an epidemic, it is a notifiable disease under the Epidemic Diseases Act. So what is black fungus? It is an infection, and it is caused by a fungus mold called mucormycosis. It was earlier called zygomycosis by Paul Toff in 1885, and later it was coined in, I think, 1957 by Baker as mucormycosis. This is how the fungus, this dangerous fungus, looks under the microscope. You have these filamentous long structures, and they are called hyphae. Then you have these sporangiophores, which secrete these small round particles called spores. And the spores are the infected component. Mucormycosis is usually a very rare infection. When you look at the global prevalence, it is 0.005 to 1.7 per million population. Very rare. But in India before COVID, the prevalence was 140 per million population, or 80 times higher in India than the rest of the world. So India is actually the capital of mucormycosis. But what happened during the epidemic? During the epidemic, the prevalence in India is more than 1,000 per million population. Huge surge. And when you compare the fungus, black fungus, in India as compared to the rest of the world, 80% of the black fungus in this epidemic is from India, and only 20% from the rest of the world. And that's an important point to note. What are the risk factors for developing black fungus? As mentioned, it's people with low immunity that develop the disease, uncontrolled diabetes, inappropriate steroid use, people who are treated for cancer and solid organ transplants. These are the people who develop this black fungus infection. There was a very good study by Singh on mucormycosis in India, and they found that among patients with mucormycosis and COVID-19, 80% were diabetics. About 14% had a diabetic complication called diabetic ketoacidosis, and corticosteroids were used for treatment in about 76 patients. The point is that the majority had diabetes and were on steroids. This slide should make you think. As I said earlier, mucormycosis is a rare disease. There are millions of patients in India suffering from uncontrolled diabetes who are on steroids or who have had cancer treatment. But very few of these millions get the infection. At the same time, there are millions all over the world with COVID infection who are diabetic, they are put on steroids and have an immune system compromised. They also do not get much fungus infection. So the question is, why is there a surge in black fungus in India during the second wave? I have simplistically tried to give you an explanation as to why it happens. We all know that diabetes and corticosteroids increase the blood sugar. They also decrease immunity. But what is new in the second wave is a Delta variant of COVID-19. The Delta variant is the Indian variant, and it is this variant that has infected the majority of Indians during this second wave. We didn't have it during the first wave, and it is not found in many parts of the world except recently. So all these three, they are called the unholy trinity: steroids, COVID-19, and diabetes. But I think it's COVID-19 Delta variant, which is the major culprit, which causes increased blood sugar, decreased immunity, and a combination of these leads to an infection with mucormycosis or black fungus. How is the black fungus transmitted? How does it pass into a person and infect the person? It is by inhalation of the fungal spores. I showed you those small round spores. They go through the nose. Normally, when a person, it is there all over. And when it goes through the nose, we have policemen of the body called neutrophils. They come and swallow up these fungal spores. But when a person is immunocompromised, the policemen are not working properly. They are defective. And so the spores escape. They go up into the nose, into the sinuses. The sinuses have got a humid environment. And in a humid environment, the fungus grows. From there, it can go up behind the eye or into the brain. A second mode of transmission, in addition to inhalation, is swallowing of the spore. When you swallow the spore, it goes into the stomach, and there it causes stomach or intestinal problems. And in a person who has got a skin trauma, these spores can infect the traumatic area and cause skin infection. So what are the types of mucormycosis or black fungus? The most common is rhino-oculocerebral mucormycosis. That is, it affects the nose, the sinus, the eyes, and the brain. This is the most common type that is found in India. It is also the most common type that we see during this present epidemic. Then, of course, it can involve the lungs, called pulmonary mucormycosis. It can affect the stomach and intestines. It can affect the skin, or it could be disseminated Disseminated is once it comes in, it goes all over the body and infects the body. So what are the symptoms? Or how do they present? As I said, most of the cases are rhino-oculocerebral. As mentioned earlier, the symptoms are there may be a nasal block, there may be a nasal discharge, one-sided numbness on the face, one-sided facial pain, one-sided headache. If it comes into the mouth, you could have toothache and loosening of teeth, falling of teeth. If it goes behind the eyes, blurred vision, bulging eyes, as seen in this patient. If it goes into the mouth, it can also produce black patches. And if it goes into the brain, you can get fits and you can get disordered mental state, etc. These are rarer. The second most common is the pulmonary mucormycosis, where they get breathlessness, cough, chest pain. If it affects the stomach or an intestine, abdominal pain, diarrhea, vomiting, blood in stools. The skin mucormycosis usually happens on hands and legs, and it again produces black discoloration of the skin. And disseminated mucormycosis is a dangerous variety where there is a death rate of more than 90%. So how is the diagnosis done? Usually by nasal endoscopy and biopsy. They put a thin tube through the nose and it is just like an endoscopy into the stomach and intestine. They pass it through the nose, you can see it on a monitor. And you can look at the sinuses, you can look at the back of the back. And therefore, once you see something suspicious, you can take a biopsy. The biopsy can be looked at under a microscope. And when you see these sort of filamentous structures, then you know that this is black fungus infection. CT scan is another diagnostic mode. This is mainly done to see the extent of the disease, because many times you need surgery and the surgeon wants to know how much inside. Has it gone behind the eye? Has it gone into the brain? Or is it gone only into the sinus? They need to know the extent of the disease, for which they need CT scan. It can also be used for a diagnostic purpose. Now going on to treatment. An important thing for a doctor or even a patient is to have a high suspicion. When somebody has COVID during the disease and even after the disease, one should have a high index of suspicion. Any pain, any blocked nose, don't ignore it. Go to a doctor and make sure that you're checked up. Because making an early diagnosis is very crucial. A delay in diagnosis, you may lose the boat and have major problems. Control of blood sugar is crucial. The blood sugar should be controlled during the disease and even after discharge, especially diabetics. Sometimes it is said that the Delta variant of this virus inhibits the beta cells of the pancreas, and they are the ones which secrete insulin. So when you have less insulin, you have more blood sugar. So people who are not diabetic, suddenly when they get COVID-19, they become diabetic because the sugars go up. Sometimes once they recover from COVID, the sugars come down. Or people who are on the borderline, they may become diabetics. So it's important to keep checking the blood sugar even after discharge. The COVID-19 infection should be treated adequately. Another important point, do not overuse steroids. Do not abuse steroids. When a doctor, even you have mild symptoms, there is no need to take steroids. There are definite guidelines by ICMR. So if a doctor tells you you need steroids, please do question him also. I've got a mild infection, my oxygen saturation is normal. I don't have any problem, why do you want to give steroids? And usually it's a 5-day course of steroids, not a prolonged course unless you have very severe disease. Once a diagnosis is made, medical treatment for the infection the fungus should be treated early. They say even a delay of 24 hours can make a difference in the prognosis. Now going on to the actual treatment, the treatment is multidisciplinary because it involves many organs or many areas. It is a team of microbiologists, physicians, neurosurgeons, ENT specialists, ophthalmologists, dentists, and surgeons. The medical therapy, as mentioned, the drug of choice is liposomal amphotericin B. It's an injectable medicine. It should be given for a long period, 4 to 6 weeks. And it is expensive and it has got side effects. And as you have been seeing in the news, there is a lot of black marketing going on and unavailability of this drug because it has only got very few uses. So people do not manufacture it in large volumes. But I think now the government has moved in and the manufacturer has stepped up. The second line of drug, as Mr. Chandan has told you earlier, is posaconazole tablets. In CMC, one of the CMC infectious medicine group has found many people, especially in the lower economic strata, cannot afford amphotericin B. It's an expensive drug. So they have given the injection for about 7 to 10 days, about 10 days or 2 weeks, and followed it up with posaconazole tablets and have found a fairly good result with this form of treatment. Then surgery is also a very important form of treatment because all infected tissues have to be surgically removed. And in late stages, some patients may even lose their eyes or their upper jaw. The surgery should be radical because all the area which is involved have to be. Now coming on to prevention, I've given you the do's and the don'ts. The do's are control blood sugars, as I mentioned earlier. Monitor blood sugar levels post-COVID-19 discharge. While in hospital, most probably somebody is going to measure it for you. But post-discharge, even if you have not been a diabetic, please do check your blood sugars. Use steroids judiciously. And as mentioned, use clean, sterile water for humidifiers during oxygen therapy. Use antibiotics and antifungals judiciously. Don'ts. Do not miss warning signs and symptoms. When you have a blocked nose, don't think it is usual sinusitis, especially if you have had COVID-19. Have a checkup. Early diagnosis is the key. If a doctor tells you, I need to do an endoscopy to look at your inside of your nose and sinus, don't run away and come back later because you would have missed the boat. And don't lose crucial time to initiate treatment for mucormycosis. Is mucormycosis a serious condition? I would call it a devastating disease. If the infection is detected early, you often recover with medicines. But if the treatment is delayed, there is a death rate as high as 50%. So it is a really dangerous disease. Now, finally, coming to the last part of my talk, what are some of the myths? As mentioned, mucormycosis is called black fungus. Is it because it is black in color? You see these black patches, but actually the fungus is not black in color. What the fungus does is, it is a very aggressive fungus. It goes into the blood vessels and blocks the blood vessel supply. So once the blood supply is blocked to the tissue dies or becomes just like diabetics have gangrene of the foot. A gangrene of the foot is black in color. So like that dead tissue is black in color, and that is what gives this black color with black fungus. So actual fungus is not black in color. Eating raw fruit causes mucormycosis. Again, this is a myth. There is no data to suggest that eating raw fruits causes mucormycosis. Mucormycosis spreads from one person to another. So don't go and sit near the person. Again, it's a myth. It does not spread from one person to another. And it used to be said in the media, in the grey publications, that black fungus is spread from contaminated oxygen cylinders, soil masks, and steam inhalation. But there is no data to show that this really happens. But after the black fungus, I'm sure you must have come across news that there is a white fungus, there is a yellow fungus, and now they say from Indore that there is a green fungus, and they are all more dangerous than black fungus. But actually, there is no evidence that any of these colors are more dangerous than black fungus. Another important point, which I would like to leave with you, is there are many manufacturers of cars. You can have Mercedes, you can have BMWs, you can have Jaguars, etc. And the cars can be of different color. You can have white cars, green cars, blue cars, red cars. So when somebody asks you what car you have, do you tell them, I've got red car, blue car, green car? That only a child will tell. It is the same with a fungus. Each fungus has a name, and the fungus should be called mucormycosis or candidiasis, or yellow fungus, which they call actinomycosis. So it is important to call the fungus by name and not to call by colors, because the same fungus may produce two different colors at different sites. When you look at medical literature or publications or books, no color is mentioned. It is only the media that has given this color to these funguses. So the take-home messages from my talk: we do not understand fully the virus or the COVID-19 disease. It is an enigma, and we are still in the process of learning and understanding. There has been an epidemic of mucormycosis infection, or the black fungus as it's called, during the second wave of COVID-19. More than 30,000 patients with COVID-19 disease were infected during the second wave. Uncontrolled diabetes, inappropriate use of steroids, and most important, the Delta variant of SARS-CoV-2 virus are the major factors responsible for this surge of black fungus. We have looked at the mode of transmission, symptoms, diagnosis, and treatment of this disease. I assure you that mucormycosis is a devastating disease with more than 50% deaths, especially in the later presentations. There are many myths associated with it, and two of the important ones which I showed you is the fungus is really not black in color, and it does not spread from person to person. Thank you very much.
Thank you, Doctor.
Thank you.
And now we can move on to Dr. Rabindranath.
Dr. Rabindranath, you can share your screen.
Yeah. Am I audible?
Yeah.
Yeah.
Yeah. And Professor Ashok Chakko for giving this opportunity to speak about this, after effects of this COVID-19 infection. So first of all, this COVID-19 SARS-CoV-2, COVID-2, we have to understand few basics that this is an COVID-19 is the name of the disease, and the virus name is SARS-CoV-2. Actually, these viruses are not new to the human, because the knowledge of human, that is, these viruses used to cause common cold, usual flu. For centuries long, the humans knew about these viruses. The coronavirus is a novel virus that belongs to the beta coronavirus. And the three novel viruses that we have now studied is the MERS-CoV viruses, SARS-CoV virus, and the SARS-CoV virus variant 2. The one fun fact is like the viruses are labeled as novel. Novels have this parts of part 1, part 2, part 3. This SARS-CoV-2 is playing like wave 1, wave 2, and third wave, etc. We should have named it a short story instead of a novel. The other thing is, what is a coronavirus name? What does corona mean? Actually, the corona means it's like crown for spikes. That is, in a cross section, it looks like a crown with spikes actually. So the important of this spikes is it allows it to attach to the human cell receptor in upper and or lower airway. So the other important thing about this slide is this virus has a lipid bilayer. So it thus means that that soap destroys lipid. So washing our hands with soap destroys the lipid bilayer so that it destroys the viruses. So this is the basic of teaching, that we should wash our hands with soap regularly. So regarding the COVID test, we'll be saying the important things that public should know regarding the COVID test. One of the things is like virus is cannot be seen. Viruses are not being seen through the microscope, and those viruses are not easily culturable. That is, like, you cannot grow a virus and prove that is a virus. So what we have is like blood tests or swabs are showing that antigens and antibodies only. So what we usually do as sensitive test is RT-PCR. The important thing I want to convey with the talk is that if someone goes and checks the RT-PCR, if it comes positive, it is positive almost 100%. That is, the false positive rate is almost nil. But if someone goes and checks, if it is comes to be negative, still he can be positive up to 30%. That is, the sensitivity is 70% and the false negativity is 30%. This is because of the technique they use to take the swab, the timing of the test, the control values, the lab samples, the multiple errors, and that is why even someone has an RT-PCR negative report, but still he has the symptoms of COVID and he is getting sick. It is better to get admitted. And the recent guidelines of Government of India also said that there is no need for a COVID RT-PCR positivity report to get admitted into a corona ward. So that there is a rapid antigen test kit that gives a report faster, but the problem is it is still, the sensitivity is still lesser than that of the RT-PCR. So whenever the RT-PCR is there, it is the gold standard one, and it is advisable to go for the RT-PCR. So few important things I want to mention and insist here is this RT-PCR and rapid antigen test depends upon when are you giving the sample, taking the sample, testing it. If you're going to take during the viremic phase, that is day 1 to 7 only, it is significant. Otherwise, if we are going to take on 8 and day 10, if it turns out to be negative, it doesn't mean that you don't have the disease. So if a person develops symptoms, the time duration to check the RT-PCR and rapid antigen test kit is 1 to 7 days. That is important. The other thing that is the public usually nowadays there are many WhatsApp forwards regarding Now, what is the CT value of your RT-PCR? Simple RT-PCR positive, negative doesn't mean anything. What is your CT value? As if everybody knows what is CT value and how to interpret it. Basically, this CT value, even doctors are not, those treating doctors are not even bothered to carry out the CT value. Why? Because there are some WhatsApp forwards you can see. If the CT value is less than 35, it is strongly positive. It is more than 35, it may not be so significant, etc. But the reality is actually the CT value depends upon the sampling, how did the sample has been done. That is like if the sample has been properly taken in the same patient in two set of values, the CT value can vary. So that doesn't mean, so what the public, the patient should know, if the RT-PCR is positive, it is positive. If it is negative, it is negative. Don't go in details of the CT value, that will confuse you and cause confusion in the all the care of the patients. And the next thing, what the public now has all been educated too much regarding COVID is like CT scan. Whenever the patient has said what they are having COVID, coronavirus infection is positive. And the next question is, what is the CT score of him? So the thing is like these CT scores are usually misleading the actual status. That is not the doctors, I'm saying the public. Regarding actually, the CT scan should be done after 5 days of symptom onset. Because there is a time for the virus to cause inflammation, and the body should counter-regulate with inflammatory activity, causing fibrosis. CT scan showing changes. If someone takes the CT on the second day and has mild COVID or nothing, no changes of COVID, that doesn't mean that he will not be developing severe COVID. So it is always imperative that a doctor who is treating should decide upon the CT. And nowadays we see many people doing CT scan for themselves, by themselves, etc. That will lead unnecessary confusion and missing out the actual treatment required. So the one thing what we should know is, like, if the CT score is more than 15, above 60%, then the lung involvement fibrosis are more than 60%, it is severe. So they may be requiring hospitalization of more than 1 week. That is what exactly what we should know. So what is the treatment? It is not based on the CT score or CT scan score. It is based on the actual status of the patient. Whether what is the saturation of the status, what is the patient's respiratory rate, what is the comorbid status, what is the availability of the nearby hospital, what is the availability of nearby COVID care centers, the availability of the ambulance services, everything, the preparedness of the treating hospitals nearby. So many conditions are deciding the treatment admission criteria for a COVID-19 patients. So few tests we should know about the basics. One thing is, like, whenever a patient gets infected with COVID, we usually do this CBC and CRP. That too, even on the second day of infection, this CBC means that complete blood count, and CRP means C-reactive protein. These are basically to show the amount of activity of inflammation that is going on. So if we do on the second day or the third day, we may see a normal value. Patients who are having mild symptoms with normal value may not follow up, or they may not get a proper treatment accordingly. So it should be imperatively noted that it should be done after day 5. And there are scores, actually multiple scores are there, multiple levels of classifications are there. Doctors will take care of that. But the idea is, if your CBC CRP is normal in day 2, day 3, that means nothing. It actually after day 5 to day 14 exactly, these values are very much important. The other things are that LDH, ferritin, D-dimer, interleukin-6, these are all inflammatory markers that decide the status of activity of inflammation. The very basic thing what I want to stress upon is, these things should be done in hospital. We have seen patients who, as a package, they get symptoms on first day, second day do RT-PCR, the third day they by themselves order all this as a package and get this investigations and coming to the hospital, or deciding that these are all very minimal. I mean, there is in the low level only, so we'll not get. These are all not advisable. So these tests should be done in hospital under the supervision and then advised by a doctor. So regarding investigation, what we should learn is not to do without doctor's advice. Exception is RT-PCR, because you may not get a doctor appointment to get an RT-PCR timely, and the timing of investigation, early investigation or late investigations, both may be giving a false confusions. And repeating RT-PCR, this one point I want to stress again is like, when do you want to repeat RT-PCR and say I am cleared from COVID? Actually, there is no guideline for repeating RT-PCR. There is no need for repeating RT-PCR, because even after 14 days, if your RT-PCR, even if it is positive, your infectivity rate is less and your damage because of the virus is less. It is like the inflammation is causing the damage. The second point is like, RT-PCR is not the criteria for discharge. If the RT-PCR is positive or negative, it is not the criteria for discharge, and RT-PCR is not the criteria to keep you prolonging the hospitalization. It is not indicated to repeat the RT-PCR to decide upon the treatment. And the one more WhatsApp forwards, a famous WhatsApp forwards, which test you should do before taking vaccination. Already people are panicking and people are avoiding vaccination due to all these false rumors. And this once again added to that, saying that you should test this CRP, HSCRP, this and that. Actually, there is nothing, no test, no investigation should be done before taking in vaccination. People may ask that we heard a few doctors even speaking about CRP. If it is raised, if you take vaccination, that will cause problem. No, actually, CRP is an indicator of inflammation. Inflammation is very common in many diseases such as coronary artery disease, diabetes, your many inflammatory diseases. CRP will be high only. That is not a contraindication for taking vaccination. So don't do any test before vaccination without a doctor's advice. Taking vaccination is the utmost God what we have. So now I'll go for the next level of my speech, like what the aftercare of COVID infection. What is long COVID? The point is like, what we should know is, the one good thing is like, this COVID will cause severe disease only in 10 to 15% of the cases, and only 5% will become critically ill. Even in the second wave, this is the truth. So 80% of the people will be having mild symptoms or moderate illness. Those people will recover within 2 weeks. So if you see the time of severity that should be taken care properly is like the 3rd day to that 14th day. That is the correct thing. But in case of severe disease, it may extend up to 6 weeks. So the next thing what we should understand is, what is post-COVID-19? So there are no accepted terminologies. There is an agreed terminology. The acute COVID-19 lasts up to 4 weeks. So if some patient is having symptoms on the 3rd week or 4th week, they are still in acute COVID-19 phase only. So some patients may have symptoms up to 4 to 12 weeks. That is called ongoing symptomatic COVID-19. So only after 12 weeks, if the patient is having persistent symptoms, that is called as post-COVID-19. You should remember one thing. These are all not related to the active viral infection or the infectivity. These reflect the symptomatic recovery. So there are multiple names regarding this, like long COVID, post-acute sequelae of SARS-CoV-2 infection, post-acute COVID-19, chronic COVID-19, post-COVID syndrome. The name, whatever the name we can keep, the thing is like, even though you had a COVID infection, you got out of COVID infection, that doesn't mean that you should not have a medical care. You should always follow up with the doctor whenever required, and you should always follow up with your own symptomatology whenever it changes or there are new symptoms or worsening of the symptoms. So I shall just split my topic to make it easier. Post-COVID complications, mild or severe, and in adults and in children. So the reported symptoms are umpteen. That is like, if I go through the literature, there are at least 75, 80 symptoms that has been discussed with many case reports. The most important symptoms are what the most of the people will get. So we will discuss regarding that only. The most common symptom is the fatigue. It is up to 87% of the patients will get fatigue. This is all I'm saying, like even after four weeks and, during even the period of 12 weeks, patient may have fatigue, dyspnea, chest pain or tightness and cough. These are the most important common post long-term symptoms of COVID. So regarding the severe complication is usually because of the inflammation and the counteracting of our body of dysregulated immune regulation of our body, and 3 vascular abnormalities causing thrombosis, causing heart attack, stroke, this intestinal ischemia. And the other thing is like post COVID fibrosis. Regarding this post COVID fibrosis, I had to say, if you have an injury to your skin, you can have it will heal with a scarring. Similarly, injury to the lung is a spongy organ. Injury to the lung will cause fibrosis. That is called fibrosis. The only positive thing, good news, what you will hear with this disease is this post-COVID fibrosis seems to be temporary. That is, it will improve from 3 months to 6 months in most of the cases. Because if you see tuberculosis, the tuberculosis is one of the most common diseases in India, infectious diseases causing fibrosis. Those fibrosis are actually permanent. That will cause disease lifelong. But this COVID, this thing, up to till now, the case follow-ups show that these post-COVID fibrosis are actually temporary. So what is the cause for this thing of COVID inflammation? It is like direct toxicity in virus-infected tissue, especially the lungs, the ongoing inflammation due to the post-COVID, post-infection immune system dysregulation, as I already said, vascular injury and ischemia. And there are other theories like renin-angiosystem related, because this SARS-CoV-2 usually goes and sits on the ACE2 bearing tissue, and many initial studies were trying renin-angiotensin system regulating drugs also. So the other situation, like it is the longer duration of your body responding to the virus because of the ineffective immune response. Or the one more thing what we should be carefully looking is like it could be another strain of the virus. And the other thing is like it is usually because of the strong immune response of the body to the virus. It is not the virus per se causing the problem. And the other thing is like patient who have been admitted in an ICU, intubated or ventilated, mechanical ventilated, those patients will have a lack of exercise. So in such patients, there is something called as muscle fatigue, muscle atrophy. So that will cause further worsening of that is called frailty in elderly or any long-term, any ICU care patient that happens. So this is one of the reasons for this post-COVID, long COVID. And post-traumatic stress or other mental sequelae, especially in those people who are already in the diseases like anxiety, depression, insomnia, and other mental health difficulties. So actually these post-COVID symptoms, why do they happen? That's, as I already said, it is mainly either it is because of the permanent damage to the lungs and the heart, or in the post-intensive care syndrome that happens in many diseases, starting from coronary vascular, the large diseases, coronary vascular syndrome, Guillain-Barré syndrome, and many diseases, those who have hospital admission, ICU admission more than 15 days, usually have this post-intensive care syndrome. Similarly, with COVID, those who are patients who have got admitted more than 15 days, that too in ICU, usually tend to have this post-COVID care syndrome, post-intensive care syndrome for at least for a few months. And post-viral fatigue, this is myalgic encephalomyelitis and chronic fatigue syndrome. This is studied in many viral illnesses, even in dengue, the famous dengue, chikungunya, everything. You have this myalgic encephalomyelitis, chronic fatigue syndrome, and this COVID is not new, and it is the same as other viruses cause this post-viral fatigue. So this is one of the reasons for this long COVID. And this could be because the continuity of the COVID symptoms, the cough that initially they had that has improved but still persisting. That could be a continuity of the COVID-19 symptoms. So who all will be more affected? Elderly are more affected. Obese, fatty, excess weight people are more affected. Those who already have respiratory problems such as asthma are more affected. And patients who start with more symptoms, that is 5 or more symptoms during the initial presentation, they have a chance of persistent symptoms prolonged than the rest of the people. And women usually develop less severe acute COVID, but they develop more severe long COVID than men. This is a notable disease that post-COVID happens in women more than men. So what symptoms are most likely to persist? So as I already said, it is not the same for everyone. So whomever has COVID, it doesn't mean that they should be feeling fatigue. They should be feeling headache. They should be having this diarrhea, anything like that. But the proportion of patients who are getting these symptoms are very much varied. In some population, the fatigue is almost there in almost all cases. Just like the initial time period, this fatigue was not studied at all. After this December 2020, it has been, when they started the fatigue scale, the questionnaires, they noted that it is there in almost 4 out of 5 patients. This fatigue was there. And the trouble breathing will be there for at least 3 to 6 months. That's what they say. And the chest discomfort, the chest pain, that is not typical of angina. That is like pain that is because of exertion. This pain could be there at any time, at any during nights and days without doing any work, etc. They may have this chest discomfort, but the pain is not centrally located, as in you see in the retrosternal centrally located pain that radiates to the jaws and the arms. That is a typical of the heart attack pain. That is anginal pain. It is not so typical of that pain. It is an atypical chest pain. We should learn to differentiate, because the myocardial infarction is also common in the post-COVID infection. That is why due to this higher coagulability, that is the clots in blood can be happening in higher incidence in post-COVID infection patients. There is an guideline. There is nothing like a strictly formatted this. According to the patient severity, the anticoagulation might be continued in case of moderate to severe COVID infection patients for few weeks to few months. That is why you should follow the doctor's orders and take those drugs properly after those discharge, after getting discharged also. So, and the most important, other important point is the psychological symptoms. There is a rush of cases of depression, anxiety, ideas of hopelessness, helplessness, feeling worthless. Everything happens after this COVID recovery. That even it is seen in mild patients, moderate patients, and severe patients, and the COVID just breaks the wall of hope and the strength the patient usually has, and that there are conditions of going to get a bed and getting admitted, being alone in a ward, not able to see your relatives, your friends, not able to speak regarding the disease, everywhere listening about the disease, your prognosis, etc. The post-traumatic stress disorder, PTSD, they call it. That's like they will be having flashbacks of the illness, the flashbacks and the thoughts of the illness. Initially, they thought the chest pain, the breathlessness they got during the infected. That is called post-traumatic stress disorder. It has been reported that has increase in this post-traumatic stress disorder. And one more thing is like trouble in remembering. We have seen many patients coming and complaining the same, only single complaint of like, I don't remember things. I don't remember whether I even what I spoke. I don't remember. I forget to do things. I can't focus in my work. I can't do my routine work as usual. This is happening after 4 to 12 weeks. It has been a reported thing. And one good thing is these things will improve. So how long will I be contagious? We'll come to the first question. How long will a patient who is infected will be contagious? There is no strict hard and fast evidence or based study that these people will definitely will not be contagious. But as a rule, after 10 to 14 days, after the symptoms have started, most people are no longer contagious. That is why after 10 to 14 days of even the healthcare workers, after 14 days of infection, they are allowed to come back to their work again. But this depends upon several things, including how severe the infection is, what was the symptoms, what were the treatment they received, where they are admitted, or etc. And what is the usual time for symptom resolution? It depends upon the pre-morbid risk factor. As I said, diabetes or any other respiratory illness in the past, the severity of the acute illness, they needed steroids, or they are admitted, they are given the antivirals, whether they have ventilated, everything, and the spectrum of initial symptoms. So the end point is usually uncertain. There is like there are follow-up patients. These are not these are 20,000. followed 20,000 patients, and even after 18 weeks, there are at least 14% of the patients are having some one or the other symptoms. And they followed up to 6 months also, at least 8% of the patient having one or the other symptoms. So this COVID, the very important point about COVID is not only during the duration of infection and the hospitalization or the treatment, even after COVID, 1 in 10 is being affected for at least 6 months. So that is the danger of this COVID. That is the following the COVID also, it causes problem to the public. That the producibility, the working efficiency, everything gets damaged. So when should I meet my doctor? So one thing is like some fatigue is common that can persist for a few weeks, or it may be there for a few months also. There is no necessity to meet a doctor for just fatigue. That is the point. But if the patient is having a severe COVID infection, there is always a recommendation from a doctor. You should visit after 7 days or 10 days and come back and do the inflammatory markers again. If that is the instruction given to you, that is the correct time to go. There is no need to wait or look for the newspaper or a media or someone else to guide you when to go and meet the doctor. And if you have any new symptom, if you feel worse, the symptoms already you had is worsening, that is the time you should go and meet your doctor. And the doctor might ask the same like CBC, CRP, LDH, ferritin. They may ask a repeat CT scan also for checking the current status. There is something called a secondary superadded infection, similar to mucormycosis that has already been discussed. There are multiple other secondary superadded infection that can be happening in a post-COVID status, that too in an elderly patient, that too diabetic patient, that too patients those who have this asthma and COPD. So how are persistent COVID-19 symptoms are treated? And the treatment is based on the symptoms. So if you're tired, the first point is try to get plenty of rest. The sentences, all what I have written here is here and there. The point is take rest. There is no urgency to start your work immediately. Give your body the respect and care it deserves, and you give the time for the body to recover. And it is not like immediately, if you are after 14 days, you're completely fit for doing everything. So you do only the required job, do only when you are feeling so energetic, and do only when you have the energy to do that. That is the point. So how to maintain sleep hygiene? This is important because this sleeplessness is an important topic in elderly that is now worsened with the panic attacks of getting the disease, during the disease, and after being discharged with the disease. Like how to maintain sleep hygiene? Going to bed and getting up at the same time each day, avoiding caffeine and alcohol late in the day, not looking at screens, your mobile phones or TV or laptops before bed. And this should be followed not only during the post-COVID patient, this should be followed by everybody, and most of us don't do that. So how are post-COVID-19 symptoms treated? So it actually depends upon the situation. If you find yourself sick, that is the time you have to go to a hospital. If you find you are not improving, if you find yourself sick, it means that it is not only physically. If you find you're depressed, if you find you're getting that palpitation, that increased heartbeats for unknown reason, don't have any reason to your increased heartbeat at times. So you go meet a doctor and get clarified what is it. And the other, particularly for cough, for pain, you may be given drugs for the same. And cardiac exercise, dietary changes, quitting smoking, cardiac rehabilitation is important. And pulmonary rehabilitation involves breathing exercise that will be required for most of the patients who are mechanically ventilated. And other treatments for anxiety or depression, the only medicines or only counseling, only reassuring, that depends upon how severe is your condition, how are you at that day, at that point of time. So there are some exercise and strategies to help with memory and focus also. In our population, it is not so much concentrated, but in developed countries, there are centers, those now focus on improving the memory and focus also. So is there any way to avoid persistent COVID-19 symptoms? There is only one way. Avoid getting COVID-19. So getting COVID-19 is a risk factor for post-COVID, persistent COVID-19 symptoms. So avoid getting COVID-19. most people who are infected will not get very sick. Even with post-COVID will not cause severe this thing. The mortality, the hospital admissions are not so worsen. That is not panicking high in number, but it will be there. We have to give respect for that, and it will take time to recover. So the best way to prevent COVID-19 is always everywhere almost by this time, everyone should be having the knowledge that the best way to prevent COVID-19 is to get vaccinated. It is not only helping us, it is helping the other people, the surrounding society by preventing the spread of the COVID-19. So now I come to the more severe problem, that is like pediatric post-COVID, long COVID. In adults, the COVID is usually used to be severe, and the post-COVID usually used to be mild. But in children, the COVID comes as a similar common cold. They don't have anything. They have 1 or 2 days of symptoms, a fever, a myalgia, they are not taking proper food for 1 day. That's all. The next day they will be playing normally. They will be normal. That doesn't mean that in children it is easy disease. Actually, in children, after 2 to 6 weeks of this COVID infection, up to 1% of the patient with confirmed SARS-CoV-2 develops a syndrome called as multi-system inflammation syndrome in COVID-19 in children, MISC. This is a newly coming up entity, and in worldwide, particularly the gamma variant and Brazil variant, it has been studied. The mortality rate is high there, and that is also an ongoing learning process regarding this disease. So it is important that children are not getting infected, because see, the children are, even they are getting infected, they are getting mild disease. Let them get the immunity, get the disease and get the immunity, let the herd immunity spread. That is all not correct approach, because we don't know what is the long-term effects, particularly in children. There is a studied entity called as MIEC. Less than 1% of children with SARS-CoV-2 infection after a few weeks develop this MISC. That is what you should know, how it presents. It usually presents with persistent fever and usually presents with gastrointestinal symptoms, not breathlessness. Breathlessness is not common. The common symptom is diarrhea, vomiting, abdominal pain, and fever. Almost everybody has fever after 2 to 6 weeks of onset of the COVID infection. So if someone has children, many will be not tested. We don't even know those people got, those children got infection. Some uncleared fever that has been not improving for days. This could be a post-COVID entity. So that should be taken care by a doctor. They should be shown to a doctor. So the thing is like this thing is like whether these patients, the children has to be checked with nasopharyngeal swab and the antibody. The antibody says that there is a past infection. Serology, they say. Yeah, they have to be checked for both. But there is no necessity that either the antibodies or the RT-PCR should be positive. Even with both of them negative, the patient is living in a place where it is COVID cases were high, then it should be considered as a diagnosis of MISC until otherwise proven. So the taking care of children is very much important in this point of view, because most of the children will require hospitalization. And the children with the listed the characters of respiratory distress, vital sign, tachypnea, tachycardia, shock, or the patient is having abnormal neurological symptoms, etc., they should be admitted. And prognosis of MISC, that one good thing is like most of the patients recover. 80% recover from the cardiac symptoms from 4 weeks, and most of the patients recover, but the mortality rate is still up to 2%. Using 2% of infected kids is high, because the seroprevalence in children is very, very high. We don't usually follow. And recent studies in Delhi says 70 to 80% of the children are already exposed to COVID. So if you take that 70 to 80%, if even 1% of that 70 to 80%, that is a huge number of MISC. So the best way to prevent this is that the best way to protect those children not getting COVID. The way to protect them is to protect us not getting COVID. So regarding this is a summarizing slide. What the thing is like, this post-COVID is a ongoing subject. Actually, people are learning. It takes years to study about the disease, form protocols, and underline and say, this is the disease, this is the treatment. For COVID-19, we don't have such this thing. We are just learning. So we are just learning with the advancements of the disease, similar to the vaccine, how many days the vaccine work, etc. So this has to be followed. The only thing what we can do is to take the protective measures. So don't let the hands down and keep the guards up. And the thing is like, we shall continue to follow the COVID-19 protective measures, avoid crowd, wear mask, and wash our hands thoroughly, and get vaccinated, and propagate vaccination. Getting vaccinated is the only thing that will get us back to normal. Thank you for the patient listening.
Thank you, Doctor.
Thank you.
Ravi Chetta. Ravi Chetan. Sri P. Ravindran.
രവി ഉറങ്ങിപ്പോയി.
അതെങ്ങനെ?
Thank you for a structured presentation. We thoroughly enjoyed it. Now we can move on to the interactive session. If you have any questions, you can ask, preferably in English.
Mr. Shashi V. Nair raised the hand.
He's from US. He's from US.
Oh, okay. Please ask him to speak.
Shashi Nair.
I think he's muted.
No, he's
Yeah,
Shashi mute lana. Okay. Mute lana.
Can you hear me?
Yeah.
Yes.
Yeah. Now here.
Yeah.
Now we can hear.
Yeah. I don't have any questions. Please go ahead with some other participants. Thank you very much.
Okay.
Thank you. Hello.
Anyone else? Ravi Chetan, please take the lead.
Mr. Ravi.
Yeah.
I got one question.
Yes.
To Dr. Ashok.
Yes.
Sir, about this posoconazole tablet, I am taking every day 300 mg. Actually, doctor asked me minimum 3 to 6 months it is required to take. Of course, regular test is there. Every week, either from the neuro or from the gastrology or from the END or from the this every 1 week they are checking is there. But doctor advised me to take these tablets at least 3 to 6 months. And I am very happily I'm taking this medicine. So is it any side effect is there with the tablets, sir? That's the only question I want.
Personally, I've not really used posaconazole because I'm not infectious disease person. But from what I've heard from my infectious disease specialist is, I mean, there are two ways to look at it. There is no medicine without any side effects, but you have to look at the benefits that you get. Did you take any amphotericin or was it given?
Yes, I was given, and during the admission time, they're given amphotericin, sir. That's in the injection model they're given, sir. That was.
Okay. So I think you had told me that there was some remnant of the black fungus remaining. And the important thing with any fungus infection is long-term treatment, because it takes a long time for fungus to get eradicated.
Yes,
so I think you need to continue it for that period that you have been advised. And if you don't, then it will start recurring. And once it recurs, you may not realize it. And then it may spread in and it may be a bit late. So I would strongly suggest that you continue according to what you have been advised.
I am the first case in the Army RR hospital. And I think in Delhi also, I am the first case in that.
No, I had spoken earlier. This is not recently, but maybe about 3-4 weeks ago, to the Dr. George Verghese, who is the infectious disease specialist who has been doing research work on mucormycosis and treatment. And he told me that he has been giving long-term posaconazole because many of the patients who come to CMC can't afford long-term amphotericin, 6 weeks or so. So he gives about 2 weeks of amphotericin and follows up with posaconazole for long period. And he said that about 80% of those patients have had a very good result. So I think you need to continue it. If at all there is any problem, that will be solved and sorted out. Because there are few other oral,
They are asking me.
yeah.
They are asking me every week to go and have the inspection from there. Every week, either of either gastrology or this eye doctor or the ENT or the neuro. I think I am lucky enough to have all the four. There's a Malayali doctors were there. They were very helpful to me. Not only every doctors, more than 330 to 40 doctors, they used to come and inspect me every day. And that's why I could survive, because, you know, I had been admitted in the hospital with heavy swelling in my eyes. Heavy swelling in my eyes, and doctor himself, he was telling to me, are you afraid of anything? I told, I'm not afraid. See, I feel it's a chance of surviving is only 5. If I tell it is 5, what is your opinion? I told, sir, already, if it is 5, you can do the operation, no problem, because that may be to me, that 5. I'm not afraid of that. If it is God doesn't want to help me, they can take it. And that's why, you know, I am not feeling any afraid or anything. But only as a suggestion is that only I ask the question, if posaconazole tablet is, I can continue, there's no problem, sir.
Yes, you can continue, no problem.
That's the only I got this answer. Okay, thank you, sir.
Okay, thank you.
We say Unni Menon from Gujarat, please. Unni Menon from Gujarat.
Good evening, doctor. I am calling from Kutch, Gujarat. Hello. It is audible, sir?
Yeah.
Is it audible?
Yes.
I am calling from Kutch, Gujarat. First of all, I would like to thank you for both the doctors, Dr. Ashok and Dr. Ravindranath, for giving us a good lecture, an informative lecture on black fungus and COVID-19. My question is not related
briefing a solution for this.
black fungus. My question is
So many families listen to this and get benefit of it. That's very benefited to see.
I think.
Hello.
Unni sir, paranjodu.
I have been suffering from gastro problem since last 1 year. I have consulted a local doctor here, and the sonography and the endoscopy test were done. And he told me that I am suffering from ulcer. He changed the medicine every 3 months, and I did not get any relief. So I went to Ahmedabad and consulted a doctor at Sidus Hospital, a famous gastroenterologist there. Again, I done this sonography, endoscopy, CT scan, and blood test, and finally he came to the conclusion that I am suffering from mild liver cirrhosis, and he has given the following medicine: Sompras, Ganaton, Bilipsa, Arsospol, and he asked me to take this medicine for 3 months. I don't know what is liver cirrhosis. Can you explain, sir, how it is causes?
So liver cirrhosis is a damage to the liver, and just like he said, fibrosis of the lung, which was explained by Dr. Ravindranath, there is actually scarring of the liver, which leads to a shrunken liver or small liver, which can have multiple complications. The major causes of cirrhosis in our country, one of course is alcohol, when you have to take it in large amounts. Hepatitis B virus, hepatitis C virus, which can cause chronic liver disease and cirrhosis. Then we have a recent condition called non-alcoholic liver disease. fatty liver. It's called fatty liver by when you do an ultrasound, sometimes you get a diagnosis of fatty liver. Patient does not take alcohol. So it's called non-alcoholic fatty liver. And about 20 to 25% of these people who have fatty liver over a period of time, like 20 years, develop cirrhosis. And some people develop even cancer. So these are the three major causes of cirrhosis. Cirrhosis is nothing but, cirrhosis means shrunken liver. It's a liver which has been damaged and which has reduced in size and is scarred. And it is a permanent damage to a certain part of the liver. So I do not know what, there is something called a staging. And once it has come to a fibrotic stage, normally it is an irreversible condition. So there cannot be much of reversal in that situation. But if it is mild, you can carry on with normal life. If there are any complications, then the complications can be treated. Some of the complications are, they can have bleeding, vomiting blood, or black stools, swelling of the legs, fullness of the abdomen because of fluid, and various other complications. So basically it means a liver which is damaged and scarred. That's what cirrhosis means.
Can be cured by with the medicine.
It cannot, if it is cirrhosis, it cannot be cured. But he has given, what medicines that he has given seems to be more for fatty liver. Bilipsa and ursodeoxycholic acid. All those are for fatty liver.
Okay,
So,
thank you, doctor.
What are the diets I have to follow? Diets, regarding diets.
Diet. Yeah, diet is mainly if you have some complication. Like if you have fluid overload, like leg is swollen up or fluid in the abdomen, then you have to reduce your salt and you have to reduce the fluid intake. But otherwise, there is no major diet restriction unless there is a problem which we have to tackle.
Okay, sir. Thank you very much.
Thank you. Ravicharan, മൂന്ന് പേര് Khalid, Ani Varghese, Aji Varghese, and Dr. Jayasri. Okay.
Khalid, please. Mr. Khalid.
Yeah, good evening, doctor. I'm Khalid from Bombay, Maharashtra State AMA president. So I just wanted to confirm whether somebody has some sort of symptoms. At that time, he didn't have the RT-PCR test or something like that, nothing. But later on, after 3 weeks, 4 weeks or something like that, can we make it sure that we had the disease earlier? Is there any test for that in any way? Rapid test or RT-PCR test was not done earlier when there was some sort of symptoms. Later on, whether we can convince ourselves that we had or we didn't have that COVID. Is there any way?
You know, it can be done. Definitely there is. Does Ravindran want to take it up, or I can say it? Okay, I'll answer that.
You can.
There is a test called antibody test. So when you get an infection, the body tries to protect against infection by forming antibodies. The antibodies are for a long time in the blood. So you can check the antibody level, which will tell you whether you have been infected. But if you take the vaccination, that also produces the antibody. So if you are vaccinated, then it is difficult to say whether it is from vaccination or whether it is from the infection. But if you have not been vaccinated, yes, an antibody level will tell you that you have had the infection. But
Thank you.
It makes no difference in the long term. It is only for your knowledge. Management-wise, it doesn't make a difference.
Okay.
Thank you.
Mr. Aji Varghese, please. Aji Varghese.
Good evening, doctor. I had a doubt regarding vaccine. Doctor, how long, like after how many weeks after contracting the disease can we take the vaccine?
The WHO recommends 3 months.
3 months, okay. And which one would be better if we have both Covaxin and Covishield available?
There is no major difference between the two. Covishield has got a very large base of knowledge, or it's been given all over the world to a large number of people. So the experience with Covishield is very huge. Covaxin is mainly only given in India. The WHO, I think, hasn't yet recognized it. They say more evidence needs to come. But from the Indian studies, it has shown that the efficacy rate and the safety is similar to Covishield. There has been some very minor problems with Covishield from Europe, and they've got clots on the legs, and heart attacks have happened. And because of the clots, Europe had stopped Covishield for a time. But I think now they've restarted. So Covaxin is not being given so hugely given. So, but in India, I've not had any major calamitous reports. I have not seen of Covaxin. So whatever you get, you can take. It should be all right.
Okay, doctor. Thank you.
Dr. Jayashree, please. Jayashree R.
Yeah. Good evening, all of you. The myths and facts were very beautifully explained. I would like to thank both the doctors for that. I have a question to Dr. Ashok Chaku, sir. Just like COVID-19, it has a target cell in the body, in the respiratory system. It attacks the ACE receptor and it functions like that. Do the mucormycosis have a target cell, or it simply evades the blood vascular system? And in that case, can we expect during the prognosis the entire system to be damaged?
You mean the sinus and the brain and the eye?
Yeah, does it have a particular target system
No,
or
it
cell,
doesn't
mucous cell, something like that? Yeah.
It doesn't have a targeted receptor onto which it attaches. It doesn't.
Okay.
It's a very aggressive fungus. So it actually gets into blood vessels and disseminates, or it damages tissue and goes through. It's something like a jet, like I don't know how to say that. It just destroys things in its way. There's no target, as you asked.
Thank you, doctor.
Next is Mr. Prabala Kumar. Prabala Kumar, either they can raise a hand or send a message.
Yeah, one person profile name is Eima. That man want to ask something. Okay, after Prabala Kumar.
Okay.
Thank you, doctor. Very glad to meet you, because you are both of you are very eminent doctors, passed out from Stanley Medical College, Chennai. I'm very much proud of that, because currently my daughter is also doing MBBS from Chennai Stanley Medical College.
Oh, wonderful.
So because very thank you to meet to both a very especially very good presentation. On behalf of myself, I am very proud of you. Thank you, doctor.
Thank you very much.
Next one.
A profile name called Eima. Eima want to ask something.
No.
Hello, sir.
Yeah.
അദ്ദേഹം ഓഡിയോയിലും ഇല്ല വീഡിയോയിലും ഇല്ല. എയിമ എന്ന് പറഞ്ഞൊരു പ്രൊഫൈൽ മെസ്സേജ് തന്നിട്ടുണ്ട്. അത് എന്തോ ചോദിക്കാനുണ്ടെന്ന്. ഓക്കെ, മറ്റാരും ഉണ്ടോ? രവിചേട്ടാ നോക്കിയോളൂ.
Anyone else, please? Any more questions?
Advocate M.K. Govindan.
Okay, Govindan.
Very good evening, Dr. Ashok and Dr. Vinayak sir. See, it was extremely very brief and very understandable the way you presented, both of you. It was very crisp, to the point, and we could understand each and everything. I don't think there will be any question to be needed to ask. But one thing, and I just came to know that you are both from Stanley Medical. My uncle, Dr. C.R. Pillai, passed out from the first batch of Madras Stanley. He was a leading cardiologist. So we are proud that both from Stanley is here. And especially I wanted to make you know that I'm a diabetic patient. I'm obese. I had met with a very bad accident about 34 years back. Because of that, my obese and diabetic and all is there. But my thorough checkup with Dr. Mohan, while taking, he said that I asked him why the sugar has increased. It was 6.7 and suddenly HbA1c was 7.6. Why? Then he said, for you, COVID had come and gone. I said, how did you know? We did the COVID test. So that is what I think Dr. Ashok Chako's meaning. The antibody test is what he would have meant. Because actually, he told me, anti-COVID tests we usually take. So that is the difference. It is anti-COVID or antibody. I don't understand what is the technical word. Now, anyhow, after that only, I took my 2 doses of Covishield vaccine. But still, I can feel all the joint pains are there. And initially in the mouth, some ulcer like it came. And stomach ulcer is there, they say. So I'm able to find that some reaction in the null is taking place. But with God's grace, I'm sailing with not much of problem. So what is the future? I have to take care without being attacked with black fungus or white or yellow and all. So what are the precautions I have to take?
Point number 1, still we do not know whether you had COVID or not. It's very unlikely. Second, what you should do really is to try to reduce your weight, keep your blood sugar under control. Weight reduction is mainly through diet. Exercise does improve the toning of the muscles. It doesn't reduce weight very much, but it's mainly the diet which helps in weight reduction. So have a good diet, and also to improve the immune system. I think mental health is also very important. Relaxation, breathing, pranayam, breathing exercise, shavasana, and various relaxing techniques can be used. That I think will improve our mental health. And the physical health is to reduce weight, control blood sugars. That's very crucial because it's not only the black fungus, but an uncontrolled blood sugar will lead to damage to blood vessels all over the body. So you can get eye problems, you can get kidney problems, heart problems, strokes, neurological problems. So it's a problem that involves the whole of the body. And it has come into focus because black fungus or the mucor thrives with high blood sugars. But for you, I think this is my recommendation.
Thank you. Thank you. I've been surveying 34 years, doctor. It is a mental health, my breathing exercise, what and all is possible, I do it. I can't regret that I can't go for a jogging or walking and all. So almost all parts of my body is broken and still I'm surviving 34 years. Thank you, doctor.
Thank you. Lakshmi Vijay Kumar.
Doctor, can I speak now? Doctor, I am Lakshmi Vijay Kumar. Both doctors gave a wonderful explanation about COVID-related problems. I have a simple question on mucormycosis. That is there any preventive medicine for mucormycosis, or can we prevent only by taking, by controlling diabetes or taking low level of steroids? Only is that the only solution for that, doctor? That only I want to know.
No, as far as I understand, I think the virus COVID-19 is very important. So try not to get infected by vaccination. The most important protective thing against COVID-19 is vaccination. So make sure that you are vaccinated. Make sure that you follow the COVID protocol, as mentioned in the last slide of Dr. Ravikumar: hand washing, masking, and social distancing. If you don't get COVID, it is very unlikely that you will get mucor.
Okay,
Mucormycosis.
okay.
Because there is mucor all over the atmosphere,
Yeah,
but we
that's
don't
what.
get infected. There's so many diabetics have always been there. A lot of people have been taking steroids, but you don't get mucor like what you get. Very rare, very, very rare. So it is the COVID-19, especially the Delta variant, which is there in India in the second wave, which is actually responsible. So the most important preventive measure is to prevent getting COVID. And of course, if you are a diabetic, definitely control the blood sugars, and abuse of steroids should be avoided.
Okay, thank you. Thanks a lot, doctor. Thank you.
Again, the gentleman, Aima.
Okay. Please ask. Unmute you.
Hello. Sir, I am a air veteran, 57, plus diabetic. What I feel is I am having diabetic means I have diabetes under control only, but range is around 140 fasting. So mine is that moderate diet, exercise, and social distancing and personal hygiene. These 4 I am following, and I don't find anything. My miss was positive, and she has become negative within a week. So other than that,
this is the RT-PCR.
RT-PCR.
You're looking healthy.
Me? Healthy. Weight is under control, only 67. I'm maintaining for past 15 years same. Diet is also same. And social distancing as it is there. And before Corona also it was there. And now also dieting and moderate diet and exercise. That goes.
No medicines.
Medicine, I'm the diabetic that for diabetes I'm having tablets. But still. So, good. And no much mental worries.
Sir, he is from Air Force. He retired from.
He was. So,
okay.
My kid is into medicine, 3rd year.
Pardon?
My daughter is into medicine, 3rd year.
Where is she?
KMC Warangal, Kakatiya Medical College, Warangal. Right, sir?
Okay, all the best.
Right.
Again, Aima. Who is that Aima man? Aima profile. You want to ask a question? He requested twice.
Yeah, but he is not active. No video, no, even not, no audio. Okay, next.
Sir, I have a question.
Yeah, please.
Good evening, everyone. First of all, I would like to express my sincere thanks to Dr. Ashok Chako and Dr. Ravindranath for such a wonderful session. Very explorative and informative session. Thank you very much, sir. And also would like to convey my thanks to the organizers like Govaletan, Jigumar sir, and all other organizers. My question is, sir, as of now, we all know, and doctor said, the vaccination is the only preventive measure for getting not affected COVID. But there are a lot of instances that even after 2nd dose of vaccination, people have affected COVID, number 1. Number 2, whether this vaccination will be effective for the expected 3rd wave and 4th wave also.
The vaccine, there has been 2 studies, one from PGI Chandigarh and the other from CMC. CMC was done on healthcare workers. Almost 10,000 plus people were vaccinated and compared against people who were not vaccinated. Among the vaccinated people, only 3.8% got a breakthrough infection. And as compared to non-vaccinated people, where 38% got infected. So definitely it is protective. And this protective nature has been shown all over the world. The second is those who got infection after vaccination have a much milder form of disease, and there is very little, hardly any deaths. So even if one gets the infection, it is an extremely mild infection. Most of it, they get 1 or 2 days of fever and they disappear. So definitely vaccination is very useful thing. I think today's Hindu also had a center page report on this by two people who work in CMC. So that is about the vaccination. The second one, your question?
Second one, sir, whether these vaccinations are effective for the expected
for the
third and fourth
wave.
Yes.
Yes, because what is happening is, it's not like the third wave usually will affect people who have not been infected in the first and second wave. So that is why some people say maybe children will be affected, because first and second wave, not many children are affected. Maybe children will be affected in the third wave. But recently, from AIMS, they said, no, children may not be affected. I don't think anybody can for certain say whether children will be affected or not. But there are a lot of adults who are not, because only 2.3 crores in India have been infected. We have 200 crore people. So what about the rest? There are so many people who have not been infected.
Yes, sir.
So it will probably infect those people. But what is worrying is, rather than the third wave or fourth wave, we are getting mutants or variants. Sometimes we have got a few variants. The Delta variant, they say the vaccine is not that effective. So that is why they have reduced the interval between doses from the Covishield. From now for 12 to 16 weeks, they have reduced it to again 4 to 6 weeks. Because they say one injection in CMC study, one injection protected about 61%. 2 injections protected only 67%. So it's only a marginal improvement. But when they look at the Delta variant, they feel that the protection may not be that much. And that is why they are giving it at a closer interval, especially for the older group who have got comorbid illness. So it depends on the variant. If new variants come, they are not effective against vaccine, then they will have to correct the vaccine again or tweak the vaccine to make it effective. So rather than the wave, it is probably the variant which is more important.
Thank you, sir. Thank you very much.
John Krishnan.
One more.
John Krishnan.
Yeah.
Yeah, hi, doctor. Well, I have a quick question here. So in one of your response, I mean, you mentioned that, while comparing the different type of vaccines like Covaxin and Covishield, that Covishield has seen the instances of heart attacks. But then recently, I mean, we have seen that one of my friend has lost her father within few hours of taking Covaxin. My question here is, or in fact, I mean, before asking the question, I mean, let us accept the fact that we are all living on the edge, right? Especially due to the kind of lifestyle that we lead, and especially when if you are living in a metropolitan like Delhi, right? So, so one thing that's been bothering us is if there are instances of heart attacks, is there a way that you can keep a check and balance after taking the vaccine in form of some tests or whatsoever manner, I mean, that to avoid such instances?
The thing is, it's how you would compare getting a clot or attack is just like driving a car. I mean, everybody drives cars, but you do get some accidents. It's inevitable. Or you're walking and suddenly a coconut falls on your head. It's a very rare event. The Covishield vaccine has been given to millions of people. In India also, about 24 or 23 crore people have been vaccinated. but the actual instances of problems that happen are only a handful. So I don't think, when you look at the benefits of the vaccine, it is so huge, whereas the side effects are so minuscule. So we don't have to really worry. But one thing is that don't do heavy exercises after a vaccine. Even after getting COVID, there have been instances of people who have dropped dead because they went in for heavy exercise. So be careful. Maybe take some rest for a few days after the vaccine. That is what I would advise. There's no need to do any tests or take medications for the vaccine. But if you have getting COVID, then of course they give blood thinners, which is part of the treatment schedule.
Right. Sure, doctor. Thanks a lot.
Okay, any more questions, please? Otherwise, we can move on to next. If so, then we can move on to concluding session by our President and General Secretary. First, Gopalakrishnan, please.
I think he's on mute.
Unmute.
Dear EMA members and leaders and friends, I am so impressed the presentation and advice by Drs. Ashok Chacko and Ravindranath. The outbreak of black fungus virus was brought to the world very threatened. I want to thank you, Dr. Ashok Chacko and Ravindranath solution for this deadly disease. So many families throughout this session listening to this and get benefits of awareness. It was very benefited session for all of us. Doctors like you deserve our respects, encouragement, and praise for doing what today. Thank you for being a ray of hope, sir. Good doctors always understand the responsibility better than privilege and practice. Once again, I thank you for this wonderful session. Thank you, doctors. Thank you.
Srikumar, please.
എല്ലാവർക്കും നമസ്കാരം. ഇവിടെ അഡ്വക്കേറ്റ് ഗോവിന്ദൻ അദ്ദേഹം സംസാരിച്ചപ്പോൾ സൂചിപ്പിച്ചതുപോലെ ആർക്കും ഒരു സംശയത്തിന് ഒരു ഇടയുമില്ല. കാരണം അത്രയ്ക്ക് തറോ ആയിട്ടുള്ള ഒരു എക്സ്പ്ലനേഷൻ ആയിരുന്നു ഡോക്ടർ അശോക് ചാക്കോ ആൻഡ് ഡോക്ടർ രവീന്ദ്രനാഥ് നമുക്ക് തന്നത്. അവരുടെ രണ്ടുപേരോടുള്ള ഒരു നന്ദി പറയുന്നു. വീണ്ടും ഒരിക്കൽ കൂടി ഗോപാലേട്ടൻ ഉൾപ്പെടെയുള്ള ആളുകൾ പറഞ്ഞു. എസ്പെഷ്യലി ഈ ഇന്നത്തെ വെബിനാറിന്റെ ഒരു ആമുഖമായിട്ട് ഡോക്ടർ അശോക് ചാക്കോ സൂചിപ്പിച്ച കാര്യം, ഞങ്ങൾക്ക് ഡോക്ടർ ഒരു വളരെ പ്രഗത്ഭനായിട്ടുള്ള ഒരു ഭിഷഗ്വരനാണ്. അങ്ങേക്ക് ഒരു ജീവിതത്തിൽ ഒരു പ്രതിസന്ധി ഉണ്ടായപ്പോൾ അങ്ങയെ സഹായിക്കാൻ ഒരു കാരണമായതിന് ഞങ്ങൾക്ക് വളരെ സന്തോഷമുണ്ട്. അത് ഇപ്പോഴും അങ്ങ് ഓർത്തിരിക്കുന്നു എന്നുള്ളതിലും ഉള്ള ഒരു സന്തോഷം ഞങ്ങൾ പങ്കുവയ്ക്കുന്നു. രണ്ടുപേർക്കും ഓൾ ദി ബെസ്റ്റ് പറയുന്നു. താങ്ക് യു സോ മച്ച്.
Thank you very much.
Thank you, Doctor. Now we can conclude session with a vote of thanks by Suja Rajendran, Women's Wing Convener, EMA Delhi. Please, Suja, please.
Good evening to all. It was a fantastic section. On behalf of DM EMA, I would like to convey our sincere thanks to you both, Dr. Ashok and Dr. Ravindranath. Sir, ഇത് നല്ല ഒരു സെക്ഷൻ ആയിരുന്നു, വളരെ ഒരു ഇൻഫോർമേറ്റീവ് ആയിട്ടുള്ള. എത്രമാത്രം ആ ബ്ലാക്ക് ഫംഗസിനെ പറ്റി സാറ് വളരെ ഡീറ്റെയിൽ ആയിട്ട് തന്നെ സംസാരിച്ചു. വളരെ ഇൻഫോർമേറ്റീവ് എന്ന് പറയാം. അതായത് നമുക്ക് ഒരുപാട് ഒരു ഡൗട്ട് ഉണ്ടായിരുന്ന ഒരു കാര്യമാണ് ഈ ബ്ലാക്ക് ഫംഗസിനെ പറ്റി. എസ്പെഷ്യലി എനിക്ക് തോന്നുന്നു മലയാളീസ് ആകുമ്പോൾ നമ്മൾ എല്ലാ ഇൻഫർമേഷൻ wherever we are getting that much of information we are collecting. അപ്പൊ ഫസ്റ്റ് സാറ് പറഞ്ഞായിരുന്നു ഇതിന്റെ റിസ്ക് ഓഫ് ഫാക്ടേഴ്സ്, മോഡ് ഓഫ് ട്രാൻസ്മിഷൻ, types of black fungus, symptoms, how we can diagnose these things, how we can treat, what means about the treatment and how we can prevent these things, and about the myths also. അതൊക്കെ കേട്ട് കഴിഞ്ഞപ്പോൾ വളരെ ഹാപ്പി ആയി. എങ്കിൽ നമുക്ക് ഒരുപാട് മിസ് ഉണ്ടായിരുന്നു. ഇതിങ്ങനെ സാർ പറഞ്ഞ പോലെ തന്നെ റോ ഫ്രൂട്ട്സോ റോ വെജിറ്റബിൾ കഴിച്ചാൽ അത് പ്രൊട്ടക്ഷൻ, അല്ലെങ്കിൽ കോണ്ടാക്ട്, ഒരുപാട് കാര്യങ്ങൾ 1 person to another person അതും സ്പ്രെഡ് ആകത്തില്ല എന്നുള്ളത് അറിഞ്ഞതിലും വളരെ സന്തോഷമുണ്ട്. ഒരുപാട് കാര്യങ്ങളിൽ ഒരു കൺഫ്യൂഷൻ ആയിരുന്നു ഈ ബ്ലാക്ക് ഫംഗസിനെ പറ്റി. എസ്പെഷ്യലി എനിക്ക് തോന്നുന്നു രവീന്ദ്രനാഥ് സാർ പറഞ്ഞ പോലെ അതൊരു പേര് പോലും ഇല്ല എന്നാണ് പറഞ്ഞത്, ബ്ലാക്ക് ഫംഗസോ വൈറ്റോ. മോസ്റ്റ്ലി നമുക്ക് കിട്ടുന്ന ഇൻഫർമേഷൻ ഇപ്പോൾ ബ്ലാക്ക് ഫംഗസ് ആൻഡ് ആഫ്റ്റർ ദാറ്റ് വൈറ്റ് ആൻഡ് ആഫ്റ്റർ ദാറ്റ് യെല്ലോ, ദാറ്റ് ടൈപ്പ് ഓഫ് ഇൻഫർമേഷൻ വി ആർ ഗെറ്റിംഗ് ത്രൂ ദിസ് ടൈപ്പ് ഓഫ് ചാനൽസ് ആൻഡ് ദി സോഷ്യൽ മീഡിയ. അപ്പൊ ആ ഒരു സിറ്റുവേഷനിൽ നമ്മൾ എല്ലാവരും ഒരു പാനിക്കിലായിരുന്നു. ഇപ്പം കോവിഡ് സെക്ഷൻ കഴിഞ്ഞു, നെക്സ്റ്റ് ഇത് ബ്ലാക്ക് ഫംഗസിലോട്ട് വന്നപ്പം അതിലായിരുന്നു പേടി മുഴുവൻ. പക്ഷെ ഈ ടൈപ്പിലുള്ള അതിന്റെ ഒരു പ്രിവെൻഷനും നമ്മുടെ ആ മെത്തേഡൊക്കെ പറഞ്ഞപ്പം നമുക്ക് സംതിങ് ഒരു ബെറ്റർ ഫീലിംഗ് തോന്നി. അതുപോലെ രവീന്ദ്രനാഥ് സാറ് പറഞ്ഞതുപോലെ തന്നെ അതും എല്ലാ കാര്യങ്ങളും നമുക്ക് എങ്ങനെയെല്ലാം ആ കോവിഡ് വന്നാലും നമുക്ക് എങ്ങനെ ട്രീറ്റ് ചെയ്യാം, നമുക്ക് എങ്ങനെ പ്രിവെന്റ് ചെയ്യാം. എന്തായാലും വളരെ നിങ്ങൾ രണ്ടുപേരും യു സ്പെൻഡ് എ വാല്യുബിൾ ടൈം വിത്ത് us. അതിനകത്ത് ഞങ്ങൾ ഭയങ്കര ഹാപ്പിയാണ്. എല്ലാ കാര്യങ്ങളും ഒരു ഗുഡ് സ്കെച്ച് വി ഗോട്ട് ത്രൂ ദിസ് ക്ലാസ്. ഹൗ വി ക്യാൻ ഫേസ്, അതാണ് ഏറ്റവും ഇമ്പോർട്ടന്റ്. ഇപ്പോഴും നമ്മൾക്ക് ഒരു ഡൗട്ട് ഉള്ള കാര്യം എങ്ങനെ ഫേസ് ചെയ്യും. എല്ലാവരും ഒരു പാനിക്കിൽ, എപ്പോഴും പേടിയാണ്. അതായത് ഇപ്പൊ ആദ്യം കോവിഡ് വന്നു കഴിഞ്ഞാൽ എന്ത് ചെയ്യണം, പിന്നെ ഇപ്പൊ അത് കഴിഞ്ഞ് വരാതിരിക്കാൻ പ്രിവെൻഷൻ, വാട്ട് പ്രിവെൻഷൻ വി ക്യാൻ ഡു, അത് കഴിഞ്ഞിട്ട് പിന്നെ ആഫ്റ്റർ ദാറ്റ് ഹൗ വി ക്യാൻ ട്രീറ്റ് ദിസ്, അങ്ങനെ എല്ലാം കൂടി ഒരു കൺഫ്യൂഷൻ ഉള്ള ഒരു ടൈം ആയിരുന്നു ഇത്. അപ്പം ആ ഒരു കൺഫ്യൂഷനിലെല്ലാം എനിക്ക് തോന്നുന്നു വളരെ ക്ലിയർ ആയിട്ടുള്ള ഒരു ആൻസർ സാറിൻ്റെ നിന്ന് കിട്ടി, രണ്ടുപേരുടെ കയ്യിൽ നിന്നും. അതുപോലെ തന്നെ നമ്മുടെ എല്ലാവരുടെയും കുറെ ക്വസ്റ്റ്യൻസ്, അതും അതായത് അതിനെപ്പറ്റിയുള്ള ഡൗട്ട്സ്, അതിനും വളരെ മനോഹരമായിട്ട് ഒരു ബ്രില്യന്റ് എക്സ്പ്ലനേഷൻ യു ഹാഡ് ഗിവൺ അവർ മെമ്പേഴ്സ്. അത് നമുക്ക് ഭയങ്കര ഒരു സാറ്റിസ്ഫാക്ടറി ആണ്. എന്തായാലും സാറിന്റെ ഇത്രയും നിങ്ങളുടെ രണ്ടുപേരുടെയും വാല്യുബിൾ ടൈം നമ്മുടെ കൂടെ സ്പെൻഡ് ചെയ്തതിൽ വൺസ് അഗെയിൻ ഐ ആം ഗിവിംഗ് അവർ സിൻസിയർ താങ്ക്സ് യു ബോത്ത്. ശ്രീകുമാർ സാർ പറഞ്ഞതുപോലെ സാറ് ഡൽഹിയിൽ നിന്ന് ചെന്നൈ വരെ പോയപ്പോൾ ആ എയിം ചെയ്ത ഹെൽപ്പിനെ സാർ ഇപ്പോഴും ഓർക്കുന്നു. Now also you are remembering that thing. അതാണ് ഏറ്റവും അപ്രിഷിയേറ്റ് ആയിട്ടുള്ള ഒരു കാര്യം. അതിനെ ഞങ്ങൾ സ്പെഷ്യൽ ആയിട്ട് സാറിനെ അപ്രിഷിയേറ്റ് ചെയ്യുന്നു. ഓൺ ബിഹാഫ് ഓഫ് എയിമെ അപ്രിഷിയേറ്റ് ചെയ്യുകയാണ്. ഇനിയും ഇങ്ങനെ ഒരു ആവശ്യം ഇതിൽ സെക്ഷനിൽ നിങ്ങൾക്കൊക്കെ വളരെ വാല്യുബിൾ ടൈം ആണെന്നറിയാം. എങ്കിലും ഇനിയും ഇതുപോലുള്ള ഒരു നമ്മുടെ ഒരു ഡൗട്ട് സെക്ഷൻ ആയാലും ഇതുപോലുള്ള ഒരു പാനിക് ടൈമിലാണേലും ഇനിയും വരിക. ഞങ്ങൾക്ക് വേണ്ട വിധത്തിലുള്ള എല്ലാ ഹെൽപ്പും ഒരു മോട്ടിവേഷൻ ആയിട്ട് തരണമെന്നുള്ള ഒരു request also we are having. Once again I am giving our sincere thanks to you both sir. And ഇന്ന് നമ്മുടെ കൂടെ ഇവിടെ പങ്കെടുത്തിരിക്കുന്ന നാഷണൽ പ്രസിഡന്റ് നമ്മുടെ ബഹുമാനപ്പെട്ട ഗോപാലൻ സാറുണ്ട്. സാറിനും നമ്മുടെ ഡൽഹി എയിമയുടെ പേരിലുള്ള സ്നേഹം നിറഞ്ഞ നന്ദി രേഖപ്പെടുത്തുന്നു. നമ്മുടെ നാഷണൽ ചെയർമാൻ ബാബു പണിക്കർ സാറ്, ബഹുമാന്യനായ അദ്ദേഹത്തിനും എയിമയുടെ പേരിലുള്ള നന്ദി രേഖപ്പെടുത്തുന്നു. നമ്മുടെ നാഷണൽ അഡ്വൈസർ ബഹുമാനപ്പെട്ട സി ചന്ദ്രൻ സാർ, സാറിന്റെ സിറ്റുവേഷൻ നമുക്കറിയായിരുന്നു. he was also suffering with that type of black fungus. Then also he attended this classes for getting some information about us, how he already got recovered from that. That was a luck. ഞങ്ങളുടെ എല്ലാവരുടെയും പ്രെയർ ഉണ്ടായിരുന്നു, എപ്പോഴും ഞങ്ങൾ എല്ലാവരും ഉണ്ടായിരുന്നു. എങ്കിലും സാർ റിക്കവർ ആയി, നമുക്കെല്ലാം സന്തോഷമുള്ള കാര്യമാണ്. he also present here. സാറിനും we are giving our sincere thanks. അതുപോലെ തന്നെ നമ്മുടെ നാഷണൽ ജനറൽ സെക്രട്ടറി ശ്രീകുമാർ സാറുണ്ട്. സാറിന് എയിമയുടെ ഡൽഹിയുടെ പേരിലുള്ള എല്ലാവിധ സ്നേഹം നന്ദിയും രേഖപ്പെടുത്തുന്നു. നാഷണൽ ട്രഷറർ ഉണ്ട് ആർ കെ ശ്രീധർ സാറ്, അദ്ദേഹത്തിനും നമ്മുടെ സ്നേഹം നിറഞ്ഞ നന്ദി രേഖപ്പെടുത്തുന്നു. നമ്മുടെ നാഷണൽ വനിതാ വിഭാഗം പ്രസിഡന്റ് അഡ്വക്കേറ്റ് പ്രേമ മേനോൻ മാഡം ക്വസ്റ്റ്യൻ ഒന്നും ചോദിച്ചില്ല. സാധാരണ മാമിന് എന്തെങ്കിലുമൊക്കെ ഡൗട്ട് ഇതിനെപ്പറ്റി ചോദിക്കാറുള്ളതാണ്. മാമിനും നമ്മുടെ എയിമ ഡൽഹിയുടെ പേരിലുള്ള സ്നേഹം ഞാൻ രേഖപ്പെടുത്തുന്നു. ഇത് നമ്മുടെ ഡൽഹി പ്രസിഡന്റ് ജയകുമാർജി ഉണ്ട്, ജയകുമാർജിക്കും എല്ലാവിധ നന്ദിയും. അതുപോലെ ഡൽഹി സെക്രട്ടറി ശ്രീ രവീന്ദ്രൻ സാറ്, അദ്ദേഹത്തിന്റെ ഒരു ഇനിഷ്യേറ്റീവ്, ഐ ആം അപ്രീഷിയേറ്റിംഗ് ഹിം ഫോർ ദിസ് ടൈപ്പ് ഓഫ് അറ്റംപ്റ്റ് ആൻഡ് ഇനിഷ്യേറ്റീവ് ഫോർ അറേഞ്ചിങ് ദിസ് ടൈപ്പ് ഓഫ് സെക്ഷൻ. രവീന്ദ്രൻ സാറിനായിരുന്നു ഭയങ്കര ഒരു ഇൻട്രസ്റ്റ് ആയിരുന്നു നമുക്ക് ഇങ്ങനെ ഒരു ഈ ഒരു സിറ്റുവേഷൻ. നൗ വി ആർ ഫേസിങ് ദിസ് ടൈപ്പ് ഓഫ് സിറ്റുവേഷൻ മീൻസ് സ്പെഷ്യലി ദിസ് ബ്ലാക്ക് ഫംഗസ്. അപ്പൊ അതിന്റെ ബാക്കി ഒരുപാട് കേസസ് നമ്മളൊരു വെബിനാറിൽ കൂടി നടത്തിയിട്ടുണ്ട്. മീൻസ് എന്താ കോവിഡ്, അത് ത്രൂ ഹോമിയോയിൽ എങ്ങനെ ഹൗ വി ക്യാൻ റിക്കവർ ദീസ് തിങ്സ്, ത്രൂ ദിസ് ആയുർവേദിക് ഹൗ വി ക്യാൻ റിക്കവർ, അങ്ങനെ ഒരുപാട് വെബിനാർ നമ്മൾ നടത്തിയെങ്കിലും ഈ ഒരു ഐറ്റം ഇതായിരുന്നു എനിക്ക് തോന്നുന്നു. ഈ ഒരു നൗ ദ സിറ്റുവേഷൻ വി ആർ ഫേസിങ് ദിസ് ബ്ലാക്ക് ഫംഗസ്, ഇൻ ദാറ്റ് കേസ് ഈ ഒരു സിറ്റുവേഷനിൽ ഇത് തന്നെയായിരുന്നു, ഈ ഒരു പാനിക് അഥവാ എപ്പിഡമിക് ഈ ഒരു ടൈമിൽ ഏറ്റവും ഇമ്പോർട്ടന്റ് ആയിട്ടുള്ളതായിരുന്നു നമുക്ക് ഈ ഒരു സെക്ഷൻ. അതിനെ സാർ ഇനിഷ്യേറ്റീവ് എടുത്ത് ഇങ്ങനെ ഒരു നല്ലൊരു വെബിനാർ ഇത്രയും എഫിഷ്യന്റ് ആയിട്ടുള്ള 2 ഡോക്ടേഴ്സിനെ കൊണ്ടുവന്ന് നമുക്ക് ഇത്രയും നോളജ് തന്ന രവീന്ദ്ര സാറിന് ഞാൻ സ്പെഷ്യൽ നന്ദി രേഖപ്പെടുത്തുന്നു. ഈ സ്പെഷ്യൽ എല്ലാവരുടെയും പേരെടുത്ത് ഞാൻ പറയുന്നില്ല. നമ്മുടെ സംസ്ഥാനത്ത് എല്ലാ സംസ്ഥാനത്തിൽ നിന്നും നമ്മളുടെ കൂടെ പങ്കെടുത്ത എല്ലാ എയിമ ഭാരവാഹികൾക്കും ഒപ്പം അതിലെല്ലാ മെമ്പേഴ്സിനും നമ്മുടെ എയിമ കുടുംബത്തിൽ ഇവിടെ പങ്കെടുത്ത എല്ലാവർക്കും എയിമ ഡൽഹിയുടെ പേരിലുള്ള നന്ദി ഞാൻ പ്രത്യേകം രേഖപ്പെടുത്തുവാണ്. ഇനിയും ഇതുപോലെയുള്ള വെബിനാറുകൾ നമുക്ക് സംഘടിപ്പിക്കണം. വളരെ മോട്ടിവേറ്റ് ആയിട്ടുള്ള മലയാളീസ് എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ എത്രയും ഇത്തിരി ബാക്കി നോർത്ത് ഇന്ത്യൻസെ കമ്പയർ ചെയ്താൽ എനിക്ക് തോന്നുന്നു മലയാളീസിന് ഒരു ക്യൂരിയോസിറ്റിയും ഈഗർനെസ്സും അവരെ കമ്പയർ ചെയ്താൽ കൂടുതലുണ്ട്. എന്തെല്ലാം നോളജ് എവിടെ നിന്നെല്ലാം കിട്ടുന്നോ അതെല്ലാം കളക്ട് ചെയ്യും, എന്നിട്ട് കൺഫ്യൂഷനുമാണ്. എല്ലാം കൂടെ ഒരു കൊളാബറേഷൻ ആവില്ല, അതും കേട്ട് ഇതും കേട്ട്. എന്നാലും എല്ലാ സോഷ്യൽ മീഡിയയിൽ കൂടെ എത്രയെല്ലാം ഇൻഫർമേഷൻ വരുമോ അതെല്ലാം നമ്മൾ കേൾക്കും. എല്ലാം കേട്ട് കഴിയുമ്പോൾ അപ്പൊ എനിക്ക് തോന്നുന്നു ഇന്നാന്ന് തോന്നുന്നു അതെല്ലാം ക്ലിയർ ആയത്. ഇന്ന് ഏതായാലും ഒരു 99% ക്ലിയർ ആയി വന്നിട്ടുണ്ട്. ആ ഡൗട്ട്സുകളും കൺഫ്യൂഷനും എല്ലാം. അതിനും പ്രത്യേകിച്ച് നന്ദി പറയുന്നു. എല്ലാവർക്കും ഒരിക്കൽ കൂടി നന്ദി. സ്പെഷ്യലി സാറിന് സിൻസിയർ താങ്ക്സ്. Once again, I am giving thanks.